Hello, good evening, everybody.
Good evening,
Good evening,
Supriya.
Sir. Good evening.
Dr. Amya.
Hi, Supriya Square.
So
Hi.
we have Supriya Square and we have Monica Square.
Yes. Sneha
Yes,
ma'am, hello,
yes.
good evening.
Yes.
Hello, Ajay.
Hi,
Good evening,
Amya.
Ajay,
Good evening,
sir.
Ajay.
We are live.
Good
We are
evening.
live now.
Everybody.
Yeah.
Good evening.
We are live, so please start.
Yeah, Abhishek, can you introduce our MOC, Dr. Revati ma'am, and we can start with the webinar, please.
Yes, ma'am. So, respected faculties and respected delegates, I welcome you all for the Corconnect live webinar for the Amogs Public Awareness Committee in association with Foxy PSC Committee. The webinar is on adolescent health. So, our MOC for the today's event is Dr. Revati Rane. Dr. Revati Rane is director of 100-bedded private multi-speciality hospital, Apex Hospital, Akluj, in high-risk obstetric units for 10 years. She is the director of First Rural IVF Center in area.
Abhishek, that is enough, I guess. Yeah.
Yeah.
Thank you.
So,
I
over
would
to
like
you,
to.
ma'am, for further proceedings.
Yes, thank you. So, Amogs PSC Committee, in association with Foxy PSC Committee, welcomes you all for the last event of very productive last 2-year tenure, the Amogs PSC finale, and the webinar on adolescent health. Hello, everyone. I'm Dr. Revati Rane. As an upcoming chairperson for Amogs PSC Committee 2024-26, it's my honor to have given this opportunity to conduct and witness this event as a bridging and connecting thread, and with the inspiration and support from the past chairperson and blessing from seniors, I wish to continue the good work. Now I request all eminent faculty members to join the e-lamp lightning for the auspicious start of the event. Abhishek, can you please play the music and the slide?
Yes.
असतो मा सद्गमय तमसो मा ज्योतिर्गमय मृत्युर्मामृतं गमय ॐ शान्ति शान्ति शान्ति.
Thank you. Can you play the PPT, Abhishek?
Yes, ma'am.
Please start the PPT. So after the lamp lightning, we would proceed with the introduction of today's main two people who have organized this event for us. So it's my honor to invite both the chairpersons of the PSC committee. We would start with our dear Monica ma'am first. She is the consultant obstetrician and gynecologist from Mangalya Nursing Home and Atharva Fertility Center. She has been a dynamic PSC committee chairperson for the year of 2020 to 24 and also a Foxy PSC national coordinator. She has held many posts in Amogs, SOGS, IMA, and I would call her Iron Lady because she is very meticulous, hardworking, down to earth, and very approachable leader. And I also would like to congratulate her and wish her all the best for her upcoming post in Amogs and many more. Next slide, please. So we all know you, sir, Dr. Priyankur Roy. He's consultant in fertility and gynec endoscopy, Nova IVF and Roy's Clinic, Siliguri. He's chairperson Foxy PSC committee, president VETOG FICO, president, joint secretary of Justice India chapter, ISAR executive clinical committee member, scientific committee member FIGO. And he is a magnificent academician with multiple published articles and chapters, and he has bagged many awards for his outstanding work in OBGY. So now Priyanku sir has joined.
No, he's not there, Veda. I'll go ahead with the
So I request you, ma'am, to please introduce our today's chief guest, respected President Dr. Jaideep Kang sir and Pardeshi sir.
Thank you so much, Veda, for the kind words of appreciation. Under the able leadership of both our leaders, Dr. Jaideep Tang sir and Pardeshi sir, I am very happy to host the Amogs Public Awareness Committee finale webinar on the adolescent health. Pardeshi sir has been always encouraging, and sir, thank you for trusting me with this opportunity to become the chairperson. Jaideep sir, I have been knowing since the time I was doing my residency in Rajawadi, and I've worked with sir. He has been a constant source of inspiration since then, sir. I have been seeing you working at Foxy right from those days, and you have been the inspiration behind my story. I have a great privilege to introduce you today, sir, for this webinar. He is currently the Foxy president for the current year. He has been the project lead of Foxy of the USAID projects. He has been the past Secretary General of Foxy also, and has held various important positions in various international associations, including the immediate past Deputy Secretary General of Asia Oceania Federation, the immediate past
We think Monica has lost her connection. So just to continue.
Yes, sir. Please. Yeah.
It's okay, Priyankur. That
Yes,
was a
yes, sir.
sign.
We were
कि बहुत
waiting
हो
for
गया.
you, sir.
Just
It's all
wanted
right.
to
Thank
say
you.
one word, sir. I think one of the most respected and one of the most one of the persons whom like people, you know, they just if he says a thing, you just say yes and you do it, and you can't say a no. So I think that's how we know Jaideep sir to be. So Jaideep sir, thank you so much for joining us in spite of your busy schedule. We request you for a few words of blessings for all of us, sir.
Thank you. Thank you. So thank you very much for having me here. For me, anything to do with Amogs is very much coming home. And of course, I'm delighted that the Amogs Public Awareness Committee is collaborating with the Foxy Public Awareness Committee. And I must congratulate both the chairpersons, both very good friends, and both someone I have known for a very long time. So congratulations, Monica, and congratulations, Priyankur, for putting this together. It's always very heartening to see collaboration between organizations, between committees, and between institutions. I'm also delighted, and it's a privilege to be a chief guest alongside Dr. Pardeshi sir. But of course, Pardeshi sir is very senior, and he's always been a constant source of guidance, inspiration. Thank you very much, Pardeshi sir, for all your contributions. And congratulations on a brilliant tenure as president. I think it's been a fantastic, very active, very inclusive, and very proactive tenure. So congratulations, sir. And I'm looking forward to seeing you next weekend in Pune at the Amogs annual conference, where my very dear friend and brother Kiran will take over as the president of Amogs. And I'm so happy that I will be there to witness that. Congratulations to you, Kiran. You have very large shoes to fill, but I'm sure you'll fill them very well. Let me also acknowledge the presence of Dr. Madhuri Patel, the Secretary General of Foxy, Dr. Sujata Dalvi, the Secretary of Amogs, Ameya, the Second Vice President, Ajay, Vice President of Foxy and the Joint Secretary of Amogs, and all the wonderful faculty which you all have gathered here. Supriya's here, who also chairs a committee in Foxy, the Adolescent Health Committee, no less. And of course, Parag, another very dear friend. And good to see you, Parag. See you next weekend again. And Anita ji, someone who's always such a dynamic, ebullient, and enthusiastic person. It's a real pleasure to know her and to work with her. And your brilliant speakers, Sarita and Sneha, and of course, Girish and Supriya will be the other chairpersons, and then a wonderful panel on optimizing adolescent health and what role we can play as gynecologists, which will be moderated by Priyankur Supriya with Meenu, who's, I think, close to completing her term now as the president of one of our most important societies, the Pune Society, and wonderful panelists with Pranjal, Monica, Dr. Rashmi, Dr. De, Dr. Mangal, Bharti, Dr. Madan, and Dr. Sheila. And finally, of course, thank you, Revati, for anchoring the program and being the MOC. I've been an MOC for I don't know how many years in so many programs. I know it's not always the easiest job. And thank you very much for everything that you bring to the role. And congratulations and all the best for your new role as chairperson in Amogs. Thank you again for having me here. As I said, it's always a pleasure and a privilege. And I'm looking forward to meeting everybody next weekend in Pune. Thank you.
Thank you so much, sir. I request Priyankur to please introduce Pardeshi, sir.
Thank you, Monica. And thank you, Jaydeep sir, for those wonderful words. That means a lot to all of us. And it's always so heartening to listen to you and be present with you, be it physical or in a virtual session. Thank you once again, sir. I would now like to invite again a godfatherly sort of a person, Dr. Rajendra Singh Pardeshi, sir, who we always look up to for guidance, for blessings, for everything. Sir is currently the president of Amogs. He has been a invited faculty of many conferences, a past VP of Foxy, has been, of course, a chairperson of the Food and Drug Committee as well. And as I said, again,
okay,
a person
Priyankur.
and a person for
okay.
support for any help. So over to you, sir, for a few words of blessings.
Thank you for your kind introduction, Dr. Priyankur. Good evening, everybody. Respected Dr. Jaydeep Tang, sir, guest of honors, Dr. Kiran Kurtakoti, Dr. Ame Purandre, Dr. Ajay Mane, Dr. Sujata Dalvi, Dr. Madhuri Patel, and Dr. Parag Biniwale, Dr. Anita Sabarwal, Dr. Sarita Kale, Dr. Monica Gupta, and our Amogs pillars, Dr. Monica Umbardhan, Dr. Sneha Boyar, Dr. Girish Mane, Dr. Supriya Rory, Dr. Pranjal Sharma, Dr. Madan Kamble, Dr. Rashmi Kahar, and Dr. Meenu Agarwal, and friends. First, I wish to congratulate Dr. Priyankur Roy, Dr. Monica Umbardhan, Dr. Shatabdi, and Dr. Revati Rane for organizing this webinar and on adolescent health. Adolescent health is very important for all, that is for family, for society, and hence for nation also. And they are susceptible to several preventable and treatable health problems like early and unintended pregnancy, unsafe sex leading to STI, HIV, AIDS, nutritional disorders like malnutrition, anemia and overweight, alcohol, tobacco and drug abuse, mental health concern, injuries, and violence. Government of India has recognized this importance of influencing health-seeking behavior of adolescents. The health situation of this group is really a key determinant of India's overall health. That's why it's important, because that mortality, morbidity, and population growth scenario. Therefore, investment in adolescent reproductive health and sexual health will yield dividends in terms of delaying age at marriage, reducing incidence of teenage pregnancy, meeting unmet contraception need, and reducing the maternal mortality, reducing STI incidence, and reducing HIV prevalence. That's why adolescent health is very important. With the eminent faculties and chairperson in this field of adolescent health, this is going to be a great event. I wish every success to Dr. Meenu Agarwal and Dr. Sneha Boyar for their future endeavor in Foxy as Vice President Foxy. And here are Dr. Bharti Rajsekar, Dr. Rashmi Kahar, and Dr. Sarita Kale are there. I wish every success to them for their future endeavor as Chairperson Foxy elections. Wishing again every success to this great event. Thank you. Thank you so much for inviting me.
Thank you,
Thank
sir,
you so
for
much.
your kind words. Yes,
Thank you so
Priyankur.
much. Yeah, thank you so much, Pardeshi sir, for your kind words. But before we move on, I would especially like to thank Dr. Monica, Dr. Shatabdi, and Dr. Revati for taking this task forward, as Jaydeep sir said, like coordinating with everyone and doing it forward, and especially the team PSC who has done all the hard work, Dr. Anita Sabarwal ma'am, Dr. Monica Gupta ma'am. We would like to thank all of you for being here, for doing all that you do for spreading the awareness in the country. And I would especially again like to thank Pardeshi sir and congratulate him for an excellent tenure. And of course, would like to congratulate Kiran Kurtkoti sir for the incoming term that we are going to have probably in a month or so. So Monica, I hand over to you and Dr. Revati to kindly take us through the scientific session as well. Thank you so much.
Yeah, so thank you, sir. And now
Revati, 1 minute. Thank you,
Yeah.
Pardeshi sir, for your gracious presence, and Jaideep sir for the blessings. Thank you, Kiran sir, for entrusting me with the further jobs in Amogs. I request Revati to please introduce our guest of honor for today. Kiran sir first.
Can I have the slides, please? Yeah, it's my honor to introduce our President-elect, Dr. Kiran Kurtakoti sir. He's
Thank you,
current Vice President.
Revati,
Hello?
it's okay. It's okay. There are 4 more to go. Thank you. Just cut off that slide. Let me start. Okay. First of
Okay.
all, thank you. Thank you everyone for inviting me on this particular forum. It's a great forum. Actually, PM stands for Prime Minister. PM stands for Prime Minister. Prime Minister stands for power. And PM also stands for Priyanku and Monica. So they have taken this power pact. Look at the people who are there who have joined. You have the president of Foxy, you have president of Amogs, you have entire Amogs lying in front of you. You have the Foxy vice presidents in waiting again in front of you. And I'm sure Revati, you are also will be doing a great job in Amogs. And of course, Monica, you are also going to be a zonal coordinator and going to do a great job in Amogs. We look forward to Sneha. We look forward to our own Dr. Minu going further. And this particular, yeah. And as far as the adolescent health is concerned, our own Amogs people, Supriya Arwari and Girish, have taken adolescent health to a very great heights. And I'm sure the next incoming chairperson is going to do the honors. And Supriya Jaiswal ji also, welcome to this forum, and I'm sure that you'll do justice to the post that has been entrusted to you. So thank you so much. I take this opportunity to welcome you all for the next weekend. Be with us in Pune, and Pune Society is all yours. You are all welcome to be members of the society also. We are ready to give you honorary membership also. So thank you so much, and I acknowledge the presence of ICOG chairperson-elect Dr. Parag and Anita ji also for this forum, and of course my brother in all my good deeds and bad deeds, Ameya and Ajay. Thank you so much. Thank you for being with us. Thank you.
Thank you so much, sir, and heartiest congratulations to you, and all the best wishes from our side too, sir. Thank you so much for joining in. Abhishek, can we have the...
Yeah. So for the second guest of honor, we have Dr. Ameya Purandare sir. He's the second Vice President of Amogs 2020. Hello, sir. Naam hi kafi hai. So I would just say that. I wanted to just say that. So over to you, sir.
Yeah. I mean, this is a very unique situation that both Monica and Revati have been my students in their residency and undergraduate resident training period, and to see them achieve this, I mean, I'm really delighted, pleased, proud, privileged. I feel that Amogs is in safe hands. For Monica and Revati, I think Monica especially, the way she has worked in the public awareness committee. She comes from Solapur, and which is from the holy land of Pandharpur, not very far away. And Tukaram had said that समाजात जर काही प्रगती व्हायला पाहिजे तर जन आणि जागृती ही फार महत्वाची आहे. So Jana is Monica and Jagruti is Revati, and that's why Jana Jagruti is Public Awareness Committee of Amogs.
Very nice. Very nice.
I congratulate both of you. We expect a lot from both of you in the future. I can already see that you all are planning a lot. I'm thankful to Pardesi sir for really ensuring that Amogs goes to the next level. Dr. Jaideep Tang for his visionary thoughts at Foxy, and all the office bearers and leaders of Foxy, Amogs, and all my friends, colleagues, seniors, juniors, everybody who are here today. I think Amogs is at a next level. We are crossing benchmark after benchmark, and I wish my friend, brother Kiran, who's going to take it even further as in his tenure of presidency of Amogs. So once again, thank you, Monica. Thank you, Priyankur. Thank you, Revati, for having me here this evening, and all the best for all of you. Congratulations on the good work done, and looking forward to even better work in the years to come.
Thank you so much, sir. Thank you for your blessings. I have learned everything by following your footsteps only, sir. You're most welcome to Sholapur on the 8th of March, sir. And I ensure you whatever you've asked for, sir. Thank you so much for your gracious presence.
Thank you.
Yes.
Yeah, thank you, sir. Once again, we have been taught well, I guess. So that is the credit goes to the teachers. So next guest of honor, we have Dr. Ajay Mane, sir, Vice President Foxy and Second Joint Secretary Amogs.
Revati, we can skip that.
Yes.
And kindly invite Sujata madam. She's senior to me.
No,
She's
it's okay, Ajay. Go ahead.
No, madam. No,
It's
please.
fine, Ajay, with me.
Yes.
It's okay. Go ahead. Go ahead.
My bad.
Sujata ma'am, we need your blessings. So please, please.
And we
Okay.
needed that smile and that
Don't introduce. I'll just start off with. Okay.
Yes,
So,
ma'am.
as a secretary of Amogs, I would like to welcome one and all. I think this is going to be one of the last few webinars under my tenure as a secretary. And for this, I would like to congratulate the Amogs Public Awareness Committee, Dr. Monica, and of course, Foxy Public Awareness Committee Chairperson, Dr. Priyankur Roy. Along with that, Dr. Revati Rane. Of course, I would also like to acknowledge the efforts made by Dr. Supriya Jaiswal, who is a chairperson for an Adolescent Health Committee, Foxy. I would like to put in the kind words and the words of wisdom which have been given by our Foxy President, Dr. Jaydip Tang. I'm very happy to say that he's going to join us in our Amogs annual conference in Pune. I would also like to express my gratitude to our Amogs President, Dr. Rajendra Singh Pardesi, whom I was fortunate enough to work for almost about 2 years. And the term would be ending sometime next week as such. I would also like to express my gratitude to our guest of honor, Dr. Kiran Kurtakoti, who would be taking over as an Amogs President. And of course, Dr. Ameya is the Amogs first Vice President. And of course, Dr. Ajay Mane for giving me an opportunity to speak before him. Today's topic is on adolescent health. Adolescent age is a very tender age and it needs to be taken well care of. And we have got an excellent speakers and excellent topics which are going to be covered. And I'm sure those who have logged in is going to learn a lot from attending today's webinar. And my best wishes to Dr. Meenu and Dr. Sneha for their future endeavor in Foxy. And of course, Dr. Rashmi and Dr. Revati and for their future endeavor in Foxy as a committee chairperson. Thank you so much. Thank you once again, Dr. Ajay Mane, for giving me an opportunity to speak before you. Thank you.
Thank you, madam.
Thank you, ma'am.
Revati,
yes, ma'am, sir.
yeah, Monica,
Yes, sir.
give me only 1 minute. Okay.
Yes, sure, sir.
Yes, sir.
Very much. I'm very much delighted to be here with all my great personalities from Maharashtra as well as Foxy. One mentor, 2 sisters and 2 brothers. So dear Dr. Jaideep sir, Dr. Madhuri ma'am, my mentor Pardeshi sir and Sujata ma'am. Kiranji, my very near and dear friend. Ame sir, who is now become Vice President of Amogs. And we all are here due to his father only, because if father would not have formed the body of Amogs, so we would not have been here. So thank you, Ame, and thank you, CB sir, for that. Both Monikas, 2 Monikas and 2 Supriya ji. Priyankur, my younger brother, Sneha Boyar ma'am, then my very near dear friend, Parag bhai, Anita ji, all the way from Delhi, Girish, again a brother, and Meenu from Pune, Pranjal, Rashmi, Shatabdi, Sheila, then our dear, the youngest chairperson, Revati, Mangal, Bharti ma'am, and Sarita Shamsundar, to whom Pardesar always called Sarita Kale. He remembers all the surnames. I am amazed about his memory, how he remembers everything. So today's topics are very beautiful because young is our future. So they have taken the task to optimize, rather not optimizing, giving them good health. So malignancies and health in all aspects of adolescents, both the topics and the panel is there. So best luck to Sneha Bhayar ma'am, Meenu Agrawal, who are from Amogs for their endeavor in Foxy. So we all are there with you. Don't worry. And Sarita Shamsundar and Rashmikar for their chairpersonship. We are again with you. And congratulations, my friend Kiran and Ame, for becoming the president and vice president of Amogs next week. And thank you, Monica ji, Priyankur, and Revati. And I'm very happy to see the outgoing chairperson of Adolescent Committee, PSC Committee, Monica, and incoming chairperson PSC Committee, Revati, for this program. So this shows the determination of our Amogs people. So congratulations to both of you, and thank you very much for calling. Best luck for the series.
Thank you, sir. I just interrupt Revati once, and thank you. I'd like to thank Ajay, sir, especially for being here, sir. I would say one thing that as you talk that both Monica and Revati ma'am are here, and they are it's a friendship that you are trying to portray over here. And thank you so much for for when the committee is under Dr. Ajay Mane, sir, there are 6 committees, and whenever one committee does a work, and sir always promotes collaborating with another committee, which is an excellent gesture, I would say, because we have already done a couple of programs in a similar way. So thank you, Ajay sir, for leading this pack of the 6 chairpersons. Of course, Foxy, but then especially this pack of 6 chairpersons and helping us grow along with you as well, sir. Thank you so much for the opportunities.
Thank you, Sujata ma'am and Ajay sir, for your gracious presence. Thank you so much for future endeavors. I now declare that the inauguration is over, and I hand over to Dr. Revati to conduct the academic session further.
Thank you, ma'am. Thank you, all respected seniors, for the time given for the sessions. So we begin with the first scientific session, that is the talk on malignancy in adolescent. For this, we have a chairperson, Dr. Parag Binewale sir, and Dr. Anita Sabrawal madam. Can I have the slide, please? Yes. Dr. Parag Binewale sir is the senior consultant obstetric gynecologist from Pune. He is beloved and I would say evergreen personality.
Thank you,
And
Revati. Don't waste your time in reading the slide.
Yes, so those
Thank
2
you.
words I wanted to say, so I said that before. Yes, sir. Yeah, so over to you. I would like to introduce our second chairperson, Dr. Anita Sabrawal ma'am. She's been Foxy Champion, Wonder Foxician, and Foxy Superstar recipient of the Foxy Dhira Award. So
Thank you.
star-studded.
I'm favorite of Foxy,
Yes.
that's all.
Yes,
Thank you.
star-studded CV, I must say.
Thank
So
you,
we are
thank you.
fortunate to have 2 chairpersons like you for the first session. And I request one of you to please introduce today's speaker, Dr. Sarita Gai ma'am.
Sure.
Okay.
Thank you, Revati, and thank you, Monica and Team Amogs, for having me here. It's indeed a pleasure to be sitting in the adolescent health session. Adolescent health has been my love for a very, very long time. And Supriya, almost 17 years ago, I was one of the first to train in the adolescent friendly health services when Dr. Durusha was president. And that is how the love affair with the adolescent health started. But today we are talking about a different aspect. And when we talk about malignancy, we could not have asked for a better speaker than Dr. Sarita Shamsundar, who is a consultant and professor at the Vardhaman Mahavir Medical College and Safdarjung Hospital. She's the chairperson of Oncology Committee of AOGD, and she has just completed her tenure as the president of the Indian Society of Colposcopy and Cervical Pathology. May I request Dr. Sarita to begin her presentation, please?
Thank you so much for the introduction, Dr. Parag. And thank you so much, Dr. Pardesi, the president of Amogs, Dr. Monica, Dr. Priyankur, the conveners. And thank you so much for the invitation. My respects to Dr. Jaideep, Dr. Madhuri Patel, Dr. Ajay Mane, Dr. Sujata, Dr. Kiran, Dr. Ameya, and Dr. Supriya. I will just upload, start share screen now. Can you see?
Yes.
Yes, ma'am.
We can see, Dr. Sarita.
Okay. Yeah, so thank you for giving me this topic of malignancies in adolescence. Yes, so it is, whenever malignancy is diagnosed in adolescence, everybody, the whole family gets so perturbed and worked up, very upset, because we really don't want, don't like to see adolescents who are bubbling with energy ill. So it's a very challenging situation for everybody. So what are the common malignancies in teenagers? One second, just. So globally, if you see 1.2 million cancer cases and 4 lakh deaths were recorded in the 15 to 39 year age group. And the common malignancies in teenagers are Hodgkin's, the lymphomas, and the leukemias. And the third is are the germ cell tumors. And then comes the CNS tumors, thyroid cancer, melanoma, and the leukemias, soft tissue sarcomas, and osteosarcomas. So for us, commonly, so the malignancies that we come across as gynecologists are generally ovarian tumors. Rarely you can have cervical and vaginal tumors. So these are the gynecological tumors. Sometimes even non-gynecological tumors can be presenting as a pelvic mass, so like lymphomas, and you can have rhabdomyosarcomas, which are coming from the muscle. So if you look at the gynecological malignancies in adolescents, so as such malignant neoplasms are the 5th commonest cause of death in the age of 0 to 18 years. And the gynecological malignancies comprise 4.2% of all malignancies in girls less than 18 years. And the commonest of them is, of course, ovarian, and the next common is vaginal malignancies. So if you look at the histology of where the origin is from and what is the histology. So if you look at the commonest, of course, are the ovarian tumors, and of them the commonest are the germ cell tumors, and the vaginal cancers are the next common, and then the common tumor is the sarcoma. And the next common is the cervical cancer, where you have the cervical tumors. So the commonest here there is the sarcoma. So apart from the ovarian cancer, ovarian tumors, where you have germ cell tumors, the other sites you have sarcoma as the commonest. I'm just trying to use my pointer. Okay, so how to approach an adolescent with an adnexal mass? So it's really important to take a proper history and ask for any symptoms of fever, weight loss, cough, because an adnexal mass in an adolescent could well be tuberculosis. And for any history of tuberculosis in the family, any history of malignancies, because we are seeing, we recently had an 18-year-old with a epithelial ovarian cancer. So I think that is probably she is, the gene positive. She has probably has a positive BRCA1. So a family history of malignancy is very important. But any history of vaginal bleeding, so because it could be a functioning ovarian tumor. Any history of breast atrophy, excessive hair growth, change of voice, clitoromegaly, all this means that it could be a Sertoli Leydig syndrome, one of the masculinizing ovarian tumor, and any urinary symptoms. So if it's a pelvic tumor or if it's a rhabdomyosarcoma, it could be actually pressing on the urethra and maybe causing problems. So on examination, very important to look for any lymphadenopathy. If it's tuberculosis, that could be a pointer. So if it's a lymphoma, you could have enlarged lymph nodes all over. If there is any hirsutism, premature thelarchy, clitoromegaly, all this indicates sex called stromal tumors. Any pleural effusion, ascites indicates some tuberculosis, or it could be a malignant ascites. Hepatosplenomegaly would point to leukemia. So what are the investigations which are important? First of all, of course, an ultrasound abdomen. And MRI is better rather than CECT, because you want to avoid radiation exposure to this young children. And CT chest to look for any metastasis in the chest. And PET has no role because it has a low negative predictive value. The tumor markers which need to be done in this age group are the alpha-fetoprotein, the LDH, beta-HCG, AMH, and inhibin when you're suspecting a sex-cord stromal tumors. And if you're suspecting sex-cord stromal tumors, estrogen, FSH, DHEAs, testosterone are to be done. And if you find a cystic mass on ultrasound, a diagnostic puncture is to be avoided because that will only increase the stage. So this is the approach, the general approach. If you have a patient with an adnexal mass, an adolescent with an adnexal mass. So first of all, you get the tumor markers done, the all the tumor markers first, and then if it's a premenarchal girl, and if the mass, whatever the size of mass, if it's more than 2 centimeters or even less than 2 centimeters, but the markers are positive, then it's important to get a karyotype, because if it's if it's an X5 karyotype, then there is a possibility of gonadoblastoma. But if it is a post-menarchal girl, and if it's a cystic mass, which is less than 8 centimeters, and the tumor and the markers are negative, then it could well be a polycystic ovary, and you can go for hormonal suppression for 2 months and look for a reduction in the size and put her on follow-up. But if this tumor is solid cystic and suspicious, and the markers are positive, then surgery is indicated. And if the cystic mass is persistent, if it's increasing in size, or it is persistent, then it needs surgery. So this should be done, they should be managed in a specialized center with a multidisciplinary setting, including adult and pediatric expertise. So what are the general principles of surgery if you have an adnexal mass and in an adolescent? What the general principles are? The surgical approach should be carefully selected on the basis of the initial imaging. So on the imaging, it's very important to know, what is the type of mass that we're dealing with, to avoid intraoperative rupture of the tumor. So oophorectomy should be preferred to cystectomy or tumorectomy, and biopsies of the tumor, FNAC and biopsy are contraindicated, except in those having metastatic disease. And the laparotomy should be a median laparotomy if you're suspecting a malignant ovarian tumor. And a minimally invasive approach is acceptable only if the surgeon is trained in a laparoscopic oncological surgery, and removal of the tumor can be performed without rupture, and no morcellation of the specimen occurs during removal, and full exploration of the peritoneal cavity can be done. And before manipulating the tumor, the peritoneal fluid should be sent for cytological examination. And if there is no fluid in the abdominal cavity, washings should be performed. And then when you do a staging, then thorough examination of the entire abdomen, peritoneal surfaces, and biopsies from the various peritoneal surfaces, and only sampling of the enlarged lymph nodes is to be done, and not lymphadenectomy routinely. And fertility sparing surgery, saving the uterus and at least part of the adnexa, is the first surgical option for consideration when awaiting the permanent histological results. Now, if there is macroscopic extra ovarian disease, apart from the ovary, if the disease has spread, then you need to take biopsies of the extra ovarian disease. And if the other ovary is involved, you take out the tumor that is there and try to leave at least part of the ovary, so that fertility is preserved. So, and supportive care should take into consideration the acute and the delayed side effects, and oncofertility counseling is to be offered to all adolescents and young adults before starting the treatment. And then the tumors, once the pathological evaluation is also very important, and it should be an experienced gynecological or pediatric pathologist. And the molecular test, maybe you can add immunohistology, IHC can be done, it can be added. Sometimes it is necessary to make a proper diagnosis. And then when do you suspect a familial tumor syndrome? So when there is a bilateral germ cell tumor, or a unilateral germ cell tumor with a streak gonad, or there's a Sertoli Leydig cell tumor, or ovarian small cell carcinoma hypercalcemic type. So in these conditions, you have to suspect that it could be a familial tumor syndrome. So coming to the commonest tumors, that is the ovarian germ cell tumors. So what are the ovarian germ cell tumors that we'll come across? So the germ cell tumors of the ovary, they could be developing, it could be a germinoma, or it could be a embryonal carcinoma, it could be coming from the embryo. So from the embryo, it could be developing as an extra embryonic differentiation, where you get it can be a coming from the trophoblast, so it becomes a choriocarcinoma, and from the yolk sac, it becomes an endodermal sinus tumor. And if it's coming from the embryo, it becomes a teratoma. And the tumor markers in a teratoma, all the tumor markers are negative, whereas a yolk sac tumor, you have the alpha-fetoprotein is positive, whereas in the choriocarcinoma, you have beta-HCG, which is positive. And in a germinoma or dysgerminoma, you only have raised LDH, otherwise alpha-fetoprotein and HCG are negative. So these are histologically, these are the common tumors: the dysgerminoma, yolk sac tumor, embryonal carcinoma. You can have the teratomas, and very rarely you get struma ovaria, thyroid tumors, and the neuroectodermal tumors. So if you come across the germ cell tumors, if you think that it's a germ cell tumor, with solid or a partially solid mass, an additional MRI should be performed. And if a solid component is present on the ovarian mass on MRI, then surgery is definitely required. And surgery, even in mixed ovarian germ cell tumor, surgery is the initial treatment. And these are the guidelines from ESGO, that is the European Society of Gynae-Oncology, and the European Society of Pediatric Oncology. And you should try and any rupture during surgery should be avoided. And bilateral salpingo-oophorectomy should not be done. At least part of the ovary should be left. And if it's a solid unilateral ovarian tumor, total en bloc oophorectomy is the treatment of choice. Cystectomy should be avoided because in a cystectomy, you could be leaving a part of the ovary part of the tumor. So it should be a salpingo-oophorectomy. And then genetic analysis, as I said, if it's a bilateral tumor, genetic analysis is to be done to look for any genetic aberrations, because, and if it's if there is a genetic aberration, then the bilateral salpingo-oophorectomy should be performed. And if its initial cystectomy has been done, outside, and the final histopathology, the final histopathology now, and somewhere outside the cystectomy has been done and the patient has been referred to you, and you find that this is probably a germ cell tumor, then additional surgery is to be performed to remove the residual tumor. And when adjuvant treatment is required, additional surgery could be avoided. So if it was an advanced tumor already, then it's only a chemotherapy can be done because they are very chemosensitive. And for dysgerminoma and mature teratoma, there's a risk of bilateral involvement, and post-operative ultrasound and monitoring of both the ovaries is recommended. And if the tumor is likely to be malignant, a laparotomic approach is appropriate for removal of tumor for staging and to minimize the risk of intraperitoneal spillage. When there is a risk of malignancy is low, then a hybrid minimally invasive approach could be discussed. Now, if you suppose if a patient has already been operated outside and then you get a post-op diagnosis of a germ cell tumor, then reoperation for lymphadenectomy is to be avoided, and routine lymphadenectomy need not be done. Only removal of enlarged lymph nodes is to be done. And a completely resected stage 1A neoplasms and have normal or negative post-operative tumor markers, and only active surveillance is the preferred approach. Now, if it's a stage 1A yolk sac tumor and non-compliant patient, then adjuvant treatment with 2 cycles of chemotherapy is optional. And if it's a stage 1B neoplasm, then it should be the histopath, it should be discussed along with the multidisciplinary team. And in the stage C1 mixed ovarian germ cell tumors, the situation is equivocal, and both options of chemotherapy and active surveillance could be discussed. Now, what about advanced stage germ cell tumors? So again, in advanced stage, fertility sparing surgery should be considered even in advanced stage because they are all very highly sensitive. And systematic ovarian biopsy is not necessary when the contralateral ovary is macroscopically normal. And so routinely, it's not necessary to do a biopsy of the other ovary. And in case of macroscopic bilateral ovarian disease, and preservation of at least healthy part of one ovary is important. And the uterus also should be preserved, unless, as I said, it reveals dysgenetic gonads. And because of the high chemosensitivity, extensive cytoreductive surgery should be avoided during initial management. And surgical resection is only required in case of residual disease. So there is some residual disease after chemotherapy, then surgical resection can be done. Now, in advanced disease, the standard chemotherapy is the BEP regime. So 3 to 4 cycles of BEP. And there are other options of chemotherapy also. But those with raised tumor markers who do not achieve negative tumor cycles after 4 cycles are considered failure. Now, there is another option. There is a condition called gliomatosis peritonei, that is an immature teratoma which has ruptured. So in that case, you cannot go for a complete surgical resection, and it is not required, but only multiple biopsies should be performed to ensure that all the tissues are mature and glial. So there is a condition called as growing teratoma syndrome. So suppose there is an immature teratoma, and then after chemotherapy, the immature elements decrease in size, but then the mature elements grow. So that is called growing teratoma syndrome, and surgical resection is to be done in that case. So this is how dysgerminoma looks. It's a solid tumor. And if there is, the patient has a Y chromosome, it's a Y, the karyotype has suggests a Y chromosome, then both ovaries should be removed. So this is the approach of a dysgerminoma. As I already said, in all the ovarian germ cell tumors, it's generally the same. So if it's confined to one ovary, then unilateral oophorectomy and inspect the contralateral ovary and do a surgical staging. There is no metastasis, static disease, and only surveillance. But if if the surgical staging has not been performed, and the patient has been operated outside, then, and you find that it is probably, it is a dysgerminoma, then follow with LDH and HCG levels. And so there is a regular follow-up program. Now, if there is a metastatic, there is metastatic disease, then unilateral salpingoophorectomy and remove the readily resectable, whatever you can resect, and go give a post-operative chemotherapy. And so it's important to get, sometimes it's really difficult to morphologically identify what is the type of germ cell tumors. So various markers are required. So these are the different markers that can be used for the germ cell tumors. So this is how a mixed germ cell tumor. Now coming to sex-cord stromal tumors, so they are rare, and the markers are usually, if you go for estrogen, dihydroepiandrosterone, testosterone, LH, and FSH, they are required when you're suspecting a sex-cord stromal tumor. So if you have a girl who has premature precocious puberty, or showing signs of hirsutism, virilization, then this is when they need to be done. And again, there are various tumor markers for the diagnosis of these sex-cord stromal tumors. And it's important to actually, again, for Sertoli-Leydig, especially the Sertoli-Leydig cell tumors and gynecoblastoma, the genetic analysis is to be done. And there is no data to support the routine need for endometrial sampling in these adolescent patients. So only endometrial imaging can be done to know the thickness of the endometrium. And again, the role of PET-CT cannot be defined. And again, the staging has to be comprehensive, with, as any staging procedure, and any tumor which is more than stage 1A will require chemotherapy. And advanced stage, again, if it has to be, whatever possible, it should be removed, and again, chemotherapy is to be done. Now, adolescent vaginal tumors, because vaginal malignancies are the second common gynecological cancer in this age group, and they're more common the 0 to 4 years, and it's mainly the sarcomas, which are the embryonal rhabdomyosarcomas, are the most common histological type, and they're commonly diagnosed at localized disease stages and associated with good prognosis and with a good survival rate. Cervical malignancies also can occur. They're the third commonest gynae malignancies, and commonly you get sarcomas, and a majority of them are embryonal rhabdomyosarcoma with a similar prognosis and treatment approach as vaginal sarcomas. And the second commonest is the adenocarcinoma. Cervical clear cell carcinoma has earlier been associated with DES, but many cases are found which are not really associated with DES. So this is the basically in a nutshell. If you find malignant germ cell tumors, so in adolescence, we know that fertility is desired, so fertility sparing surgery is to be done. And if it's a completely stage, and anything more than stage 1A, and that will need chemotherapy. And if it's incompletely stage, and you have positive imaging and positive tumor markers, then chemotherapy is to be done. So again, for the sex-cord stromal tumors, also it's mainly fertility sparing surgery. With stage 1 low risk, it just need to be observed. Whereas stage 1 high risk or ruptured stage 1C or poorly differentiated, then you need to give chemotherapy. And stage 2 and 4, 2 to 4, again, they need chemotherapy. So this is about the follow-up. So basically, any ovarian tumors, the commonest gynae malignancy that you found in adolescents, and the germ cell tumors are the most common. So the diagnosis is made by tumor markers, ultrasound, and MRI. CCT should be avoided, and the PET scan is of no benefit. Surgery should be limited to unilateral salpingo-oophorectomy, omental biopsy, or a mentectomy. Cystectomy should be avoided, and rupture of the tumor is to be avoided. Any enlarged lymph node should be removed and not a lymphadenectomy. And most of them are chemosensitive with an excellent response to chemotherapy. And consider, before starting chemotherapy, consider oocyte or ovarian cryopreservation before chemotherapy, so that they do not have, those problems, because after chemotherapy, there is ovarian suppression, and then there will be some effects even though they regain their ovulation. So I seek your support for Chairperson Foxy Gynae Oncology Committee. I have been the past president of the Indian Society of Colposcopy. I've organized many workshops all over the country and trained more about 2,000 plus Foxy members in colposcopy through various workshops. And I've been a coordinator of the Foxy Mega Screening Camps and the Northeast Cervical Cancer Elimination Project. And presently on the International Board of Colposcopy. And we organized Asia's first World Congress of Colposcopy in 2021. Thank you so much for your patient listening.
Thank you, ma'am. Thanks a lot for an elaborate lecture on the relatively uncommon topic of adolescent gynec malignancies. So I request Dr. Anita ma'am to please add a few valuable inputs on the topic.
Thank you so much, Dr. Revati. And Dr. Sarita, it was really a wonderful, very updating, very interesting presentation which you gave. In fact, the whole book on malignancy in adolescents, you have simplified and given a very clear, crystal clear message. And people like us who are at the ground level, you have taught us that history taking is very, very important, especially in these adolescents. So if we take history and we are able to make some diagnosis, so lot of morbidity, mortality, and suffering can be avoided. So we can immediately refer the patients to tertiary centers so that immediately action can be taken and all these problems can be prevented. So thank you so much. And I must tell you all, I've been working with Dr. Sarita Shyam Sundar for the last almost 17 years. And she's such a great worker. And I was her chairperson in the for the again public awareness committee of ISCCP for 3 years. And I have very closely worked with her. And even for Foxy, when Dr. Alpesh Gandhi sir was the president, we together we involved whole CRPF and all of India was covered for that. And even though the COVID had just come in, and we could manage the screening, cervical cancer screening, due to the help of Dr. Sarita Shyam Sundar. And she's one person who has, I think she's very talented, full of knowledge, but she's one person who's very grounded and who goes to, ground level to do a lot of public awareness. Even to my clinic now, she's supposed to come and do the cervical cancer screening, which we've been doing. And I have also organized the public awareness campaign also during her world conference. So I can really vouch for her. She's best person to work for Gynae Oncology Committee of Foxy. So congratulations, Dr. Sarita, again for your today's lecture. Thank you so much, Dr. Revati, and the whole team for giving me the opportunity to be here. Thank you so much.
Thank you, Anita ma'am. Thank you.
Parag sir, do you want to add something?
Sir had to go. He had some emergency. Yes. So can
Thank
we
you,
move
Anita
ahead?
ma'am.
Yes.
Thank you,
Yes,
Anita ma'am, and thank you, Sarita ma'am, for being here for our session. And we wish you all the very best from Amogs.
Thank you so much. Thank you. Thank you. Thank you.
Revati,
Amogs is one of the vibrant, societies, so vibrant groups of Foxy. So yes, thank you so much for the invitation.
All our best wishes to you, Sarita ma'am.
Thank you so much. Thank you.
Revati, can we go ahead?
Yes, yes. So we move ahead with the second session. The session is on adolescent health. For this session, we have lovely and lively dynamic amoxicillins, I would say, Dr. Girish Mane sir and Dr. Supriya Arwari madam. Can I have the CV?
think Girish has
Yes.
joined.
So first, yes, first chairperson is Dr. Girish Mane, sir. I would say he is a star of Amogs on and off the stage. He has been past president of Yavatmal OBGY Society, past chairperson Adolescent Gynecologic Committee, Amogs, and has been awarded best chairperson Amogs, and is the star singer of Amogs that we all know. Second chairperson is Dr. Supriya Arwari, madam, bubbly, enthusiastic, and full of life, Shire of Amox, who has been the slide is very small. Yes. So is a obstetrician and gynecologist and infertility specialist from Mumbai. And she has been working tremendously for adolescent health. And she is the one who keeps all Amoxicillin together, I would say. So I request one of the chairperson to please introduce today's speaker, Dr. Sneha Boyar, madam.
Thank you so much, Revati. That's very sweet of you to say that. At the outset, I would like to thank Foxy President Dr. Jaideep Tang and Amox President Dr. Pardesi sir and entire PSC team, Priyankur, Monica, for all the hard work they are doing and for allowing me to be a part of this very beautiful session. On behalf of my co-chairperson Girish, he sends his regrets because he's traveling and he's in Priyankur's hometown, so there the range apparently is lower, so he could not join in today. So it is my utmost pleasure to introduce the speaker for today, a very, very dear friend, everybody's, favorite, Dr. Sneha Buyar. Madam is International MS Signature Awardee for Phenomenal Leadership in 2020, Asia GCC Award 2021, Dr. S.N. Malhotra Individual National Award for Outstanding Work in Rural Obstetrics, Dr. Durusha Distinguished Community Services Award, Dr. Anandibai Joshi State Award by Government of Maharashtra, Lokmalt Healthcare Excellence Award, 30 years plus experience in OBGYN. That's a whopping, huge span of service that she's been giving to the cause of women, 300 plus talks, orations, and 30 plus national publications. She was in the past the Foxy Breast Committee Chair 2019-2021, GCM ICOG 21-22, Amog Chairperson 22-24, SAFOG Working Group Member and Founder President of Vidarbha ISOPAB. Presently, if I'm not wrong, she's serving as the IMA President of Yavatmal. Madam, welcome. The stage is all yours. Adolescent health, you know that it is very close to your heart as well as mine, as well as Girish. We have Dr. Supriya Jaiswal also, who is the Foxy Chairperson, who is with us. So I think without much ado, we should start with the session. Sneha ma'am, let me begin with the shairi, otherwise I will feel inadequate. So I will dedicate this shairi to all the young people, the adolescents, for whom we are, striving so hard. And all of us know that adolescent is the most beautiful time of our life. तो एक चंद पंक्तियां उस हसीन दौर के लिए जिसको हम एडोलेसेंस या जिसको हम जवानी कहते हैं कि रात भी नींद भी रवानी भी हाय क्या चीज है जवानी भी all of us want to go back there. रात भी नींद भी रवानी भी हाय क्या चीज है जवानी भी शरबते रंगीन लगता है सादा पानी भी प्लेन वाटर भी पियो तो रंगीन शरबत लगता है शरबते रंगीन लगता है सादा पानी भी हाय क्या चीज थी जवानी भी. So madam, the stage is all yours.
Wow.
Let us start with your presentation on adolescent health.
Thank you so much, Supriya, for that kind introduction. Maybe few things I have missed about which is relevant to this, talk. I think I have not put somewhere here. I'm the National Adolescent Trainer by WHO and FPI. That is since long 2007, and I'm very much into the adolescent health right from I think way back in 2000 or so. I have been doing the school health, and at present I'm the Maharashtra State Chairperson of IMA for Mission Pink Health, and I've been working very closely in association with the adolescents. So with this, I just straightway go to my topic, and I just thank the respected President Foxy and President Amox, and of course all the guests of honor. I think I would just say Dr. Jaideep Tang, Dr. Rajendra Singh Pardesi sir, Dr. Madhuri Patel madam, Dr.
Kiran Kurtakoti, dear friend, now the incoming president, Dr. Amey Purandare and Dr. Ajay Mane, my younger brother. Of course, Girish, I'm missing you. And I just straightway go to this talk of adolescent health. I'm sure it's not only the physical health, but it is the mental, social. Hello. I think we have some disturbance here. Can you please mute? Yeah. So physical, mental, social, spiritual, and of course, the financial health, I would say. Definitely, our culture is also very, very important. All of us have been talking about this adolescent health and why these adolescents or teens, I would say, land up into problems. I would not go into the details what adolescence is and what age it starts, but the problems as adolescents and in general, right from the gender, whether she's a male or female, you have different problems. How we're going to discuss in a short while. The socioeconomic status, the problems of poor girls and boys are different that from the affluent society. Education level, the literacy definitely has its impact. The lower ones have different problems, and the highly educated people have different problems. The lifestyle, the environment, substance use and abuse, I would say, sexual behavior, violence, and other risk behaviors, media and advertising, access to it, school dropouts, work, and peer pressure. So, what are the needs of adolescents? The correct information on health, reproduction, nutrition, growth and development, sexuality, of course, the sexually transmitted diseases, infections. So definitely adequate diet, healthy lifestyle, education and health. I'm sorry, just wait for a moment. So adequate diet, healthy lifestyles, education and health, safe and supportive environment, and counseling. These are the various, aspects or other needs of the adolescent health. So what are the possible problems of adolescent? The health problems like growth and developmental problems, considering the right from the height, weight, the menstrual problems like irregularity, excess flow, or maybe even amenorrhea, skin problems like acne, skin color, the mental health problems like depression, anxiety, personality disorders, suicidal tendency, and the infectious diseases like urinary tract infections or vaginitis and sexually transmitted infections. Eating disorders with its spectrum of anorexia nervosa on one side and bulimia nervosa or binge eating on the other side, leading to obesity. So, what are the possible problems due to risk behavior? Of course, all of you know if it is a high risk behavior for sexual activity, premarital sexual involvements, and the resultant STIs or genital tract infections. Early marriages may be prostitution because of habituation, teenage pregnancy, unsafe teenage abortions, bad habits like smoking, alcohol, drug abuse, and also the rash behavior leading to road accidents causing injuries and deaths, and of course, violence. What do we feel that have we thought about what are the possible reasons for these adolescent problems? It can be the educational problems, poor education because of the fear, maybe not succeeding in the education, family relationship issues, maybe the marital disharmony of the parents, the communication gap between parent and the child, of course, maybe the single parent as well, influence of Western culture. Sometimes you have controversial idols, people which you should not, follow. You may just have, maybe like Khalnayak, you can have your Nayak as well. So peer pressure at workplace or at schools, wherever the kids are, present, issues of self-esteem and issues of body images, mental health. All these problems, definitely can have impact and they can lead to the problems of adolescence. We have talked about the mental health problems like depression, suicide, psychosis, mania, conduct disorders, and anxiety disorders. In girls, of course, we have different issues. The girl can have menstrual problems, maybe very heavy flow associated dysmenorrhea. She may land up into anemia because of this excessive flow. She can have PCOS and acne, hirsutism, or maybe she can have early sexual involvement and then, of course, the STIs and teenage pregnancies. What are the common health problems or issues in boys? Mental stress, academic issues, psychosexual issues, peer pressure, so unsafe sexual practices, and of course, abuse and traffic accidents. We have wrong adults, family conflicts. How do we judge whether it is health or healthy life? Definitely, all of you are much aware that optimum body weight or BMI, no mental stress. I think that is next to impossible. But your ability to combat the mental stress, healthy diet, what is it? We'll see it in short while. Good sleep, happy morning, and of course, the blissful attitude for everyone. No addiction and no disease in the body. Of course, whatever you do, no regrets for your self activities. So we will tackle, I think we have some disturbance. Can you please mute? What is the healthy food? Whether this is the first picture, you have lots and lots of the fast foods and the, colas and thumbs up. Enriched water, no, or this is the second. All of us know that this fresh vegetables, fruits and nuts, this is the healthy food, but kalte pan varat nahi. All of us know this, but when it comes to deciding, then you may choose it sometimes. What exactly is healthy food and why so much emphasis on the nutritious food? So you have this, various picture, definitely you are leading to obesity and various diseases. Just have a look at this, what your fast food or junk food gives you. A small plate of these chips and biscuits gives you 475 calories. The burger gives you 440 calories. The pizza gives you around 800 calories. And 10 strips of this, the potato fries, French fries gives you almost 100 calories. Definitely, you can't afford it. This veg patties 350 and samosa 600 calories. When you talk about the drinks, 1 teaspoon sugar gives you 4 grams. 1 teaspoon sugar, that is 4 grams, gives you 16 calories. So 1 gram has 4 calories. And this Pepsi has 11 grams. That is almost, 600 ml. That gives you almost 264 calories. So Mirinda, almost 318 calories. So even a single drink can give you so much of calorie and you just put on weight. So improper diet and lack of proper nutrition is the most common link across most of the health problems like obesity as well as anemia and many other problems. This is just to give you an overview of, what are the top killers of adolescents in India. You can see here suicidal tendency. Suicide is almost 23.5%, and the highest one is drowning, 28.6%, vehicular accidents, 22.5%. See, the diseases are at a lower part, and the accidents are higher. So how do you try and prevent this? You definitely have 3 levels of prevention as you have for any other problem. So providing them information, educating them for these problems, and of course, for this, you need to have a focused, dedicated adolescent clinics, and you really have to make some policies to follow. Once the adolescent, goes into all this, we have, certain criteria to diagnose that your child is keeping most of the time alone, maybe in the washrooms, not responding to any other, not trying to mix up with the other family members. That is how you have to identify, changing the friends, change in the behavior, also getting irritated, frustrated very easily. So that is how you have to identify and try and reduce the risk behavior. And tertiary prevention, of course, once you have diagnosed, you know that this child has this problem, try to treat it at the earliest in a very empathetic way and try to rehabilitate this child. For the girls, adolescent girls, all of you know, we have anemia as the major problem. Everybody's talking about the gender equality, but we still have to face all this, the preference of the boy over the girl as far as nutrition is concerned. Even the health checkups and supplements, the girls are deprived of. So definitely, all of you know what is the role for hemoglobin, why you have to have a very good hemoglobin. But unanimously or universally, it is accepted that we have to have hemoglobin of at least 11 gram%. So every girl, though we say 12, I think WHO says 11 gram%, but we keep this target to achieve, to be maintained by each and every girl. Otherwise, there will be decreased hematocrit and also the decreased oxygen carrying capacity, leading to hampering of your working, your learning as well. And of course, you will be having easy fatigability, excessive tiredness, and headaches, problems in concentrating, problems in remembering. And then, of course, you will have brittle nails, soft, glossy tongue, and you may feel breathless as well. All of you are well versed with the symptoms and signs of the anemia, but it can definitely lead to certain complication, as delayed growth and development per se in toto, or maybe the girl is more prone for infections and illnesses repeatedly. Maybe if at all she is pregnant, she will land up into preterm labor, and even she can have that growth restricted baby. You may have the complications of variety of organs and organ dysfunction as well. So you have to direct your management at the cause of anemia. All of you know about this. I don't think I should include this, but just to put it in the slide for completion of the presentation, I have just put it here. You have to treat the basic cause of the anemia. If it is nutritious, you have to provide her with nutritious foods. What it has been, tabulated here, all the fresh leafy vegetables, fresh fruits, but especially the red meat, dark green leafy vegetables, oysters, egg yolk, and of course you have various nuts and legumes. And if vitamin C rich fruits, guava, citrus fruits, etc. So these are the vegetables, and of course the jaggery and groundnut. All of you know the dates also, they are very rich in iron, and of course the veg and non-veg food supplements as per the culture or preference of that particular girl we have to think about. And these are the corrective measures. You may go for the tablets, syrup, injections, or blood transfusion depending upon the severity of the cause. So for definitely treatment, anemia per se is a separate topic, but just to complete the presentation, I have included this slide. Of course, a girl can land up into, because of this junk food and obesity, lack of physical exercise, she can land up into PCOS. Almost 30% of the girls, they have polycystic ovaries. That is the recent most data. They may have irregular menstrual cycles, prolonged bleeding or spotting, and then acne, hirsutism, maybe baldness, and infertility may be the problem in future, possibility of diabetes, and even all of you know that it is not only PCOS, but it's a spectrum that can lead to genital malignancy, endometrial cancer. So you have to take care of this at the earliest. That is what is recommended. We have to suspect if any close relative has PCOS. It can be prevented by healthy lifestyle. We have to stress on her that eating healthy food and having a active physical exercise daily, regularly is the only key to success. So lifestyle management is the only treatment, though medicines play a secondary role. So we don't have to panic by reading the diagnosis of PCOS by sonography, but definitely you have to ask for the solution and work on it. Adolescent malignancies have been discussed, but yes, there are certain, malignancies of cervix also. So cancer cervix, approximately 185 women die every day. That is what is quoted here. Almost, even cervical cancer. All of you know this. What is the role of this discussion here for adolescent? It's mainly the primary prevention. What we have to make them aware of to refrain from, unprotected sexual activities. And of course, we have to advise them for HPV vaccination. All of us are trying our best to advise them that if you receive the vaccination between 9 to 14 years of age, you have to take only 2 doses, and the protection is almost 100%. That means before the girl becomes sexually active. Even for 15 years onwards, right up to 45 years, the lady can go for vaccination, and though the protection is little less. And it's not only for the girls, this vaccine is for boys as well. It can prevent the genital wart, vulvar and vaginal cancer, and anal cancer as well, penile cancers. So that is how the role of HPV vaccination. We have to explain them, encourage them for vaccination, have a word with their parents also, try to convince them. And of course, we have to explain the role of protection of this vaccine, because yes, there are many thoughts nowadays. People are going against vaccination. So this is really a challenge for all of us. So lastly, I would just quote that health is wealth, and it's not only the physical health, but mental, social, psychological, as well as cultural and financial health. All these, we have to take care of every aspect. Parents, teachers, doctors, all of us should discuss this at stage, and you should definitely have the dedicated focus adolescent clinics. We have to avoid these adolescents from their top killers of drug abuse, road accidents, suicide, drowning, and diseases. Of course, we have to advise them about what is good nutrition or healthy diet, exercise, and sound mind. These are the pillars of health. So HPV vaccination, I have just quoted, that's the last point for the adolescent health. So friends, with this, I conclude my talk, and I have tried to cover the all aspects of adolescent health in short. I thank all of you, once again, the organizers especially, for inviting me here and talking on this aspect. Thank you so much. And it's my humble appeal to all of you to, support me wholeheartedly for my candidature as Foxy Vice President from West Zone for the upcoming elections. Thank you so much. Thank you. Thanks, Chairperson. And over to you, Dr. Supriya.
Thank you so much, ma'am, and absolutely the all the best for you for your onward journey in Foxy. I think that was a wonderful talk and a very, very exhaustive to cover everything under the sun in adolescent health in such a short span is not at all easy. You have done a great job, and I think the message needs to go out in society that as gynecologists, as the primary care physicians, even as general practitioners, all of us need to be aware of the needs of this adolescent group as a separate group, and also be able to give them good advice. Several of us go to schools and colleges, and always I make it a point, as you rightly mentioned, madam, that this it is not useful only talking to the youngsters. We need to also keep their parents in the loop. So often I tell school authorities, that when you call me, make sure it is an open day or parents day when the parents are also there, especially the mothers, so that they are also in the loop when we talk about diet, we talk about good habits, we talk about, educating the young girls. It is of no use just informing them. Their parents also need to be on the same page. So thank you so much, madam. It was a really wonderful session. Thanks again to the organizers for allowing me to be a part of this wonderful program. And back to you, Revati. Again,
Thank
hi
you.
to Dr. Supriya Jaiswal, who is the chairperson of Foxy Adolescent Health Committee. And I'm sure she echoes my sentiment as I say this. And back, yeah.
Yeah, thank
And
you so much, Supriya. I would just make one comment. What you have said, definitely we need to, as I have said, we need to have the dedicated adolescent clinics where you can give privacy to the adolescent to speak for themselves. And definitely we have a combined sessions with their parents as well as teachers. So I think that
Absolutely.
works well. Thank you so much.
Yes.
Thank you, ma'am.
Thank you, ma'am.
Thank you, Sneha, ma'am. Thank you, Supriya, ma'am. Yeah, it was a very
Thank-
comprehensive and practical session, I must say. So thank you, both of you. Thank you.
Just
Revati, can I
before,
speak something?
yes, before I wind up from here, I want to make one comment. I think at least 6 or 7 of us are in scrubs.
Yes.
And
And
various
different
lovely
colors.
colors. I can see lovely
Different.
colors. Yes. Even Priyankur was in scrubs, I noticed. So I think scrubs is the, haute couture for us, for the doctors now.
Yes.
Yes.
Okay,
Thank you, Sneha ma'am,
over to you, Revati.
for
Yeah.
accept. Thank you, Sneha ma'am, for accepting our invite and being there. We wish you all the very best for all your future endeavors in Foxy. It was a very crisp talk. Thank you, Supriya ma'am, for joining us as a chairperson. Girish sir had joined the talk, ma'am, but because of network issues, he got disconnected again. But he sent his best wishes for you too. Over to you, Revati.
Thank you, Girish.
Over to you, Revati.
Yes, ma'am. Yeah. So thank you again, everyone. Now we move ahead with the next session. That is the panel discussion on optimizing adolescent health, a gynec role. And for this, today we have moderators, Dr. Priyankur Roy and Dr. Supriya Jaiswal, ma'am. CV, please. Yes, Priyankur Roy, sir, has already been introduced. Sir has joined back. Yeah. So he is the consultant in fertility and endoscopy and Nova IVF Roy Clinic from Siliguri, and he is the Foxy PAC committee chairperson. He has been introduced. So we move ahead with yes, next CV, please. Next slide. Yeah, Dr. Supriya Jaiswal, ma'am. She's Vice President, Patna OBGYN Society, Chairperson, Adolescent Health Committee, Foxy 2022-25, Joint Secretary, SOVSI, Bihar and Jharkhand Chapter, Chief Consultant at SM Hospital, Patna, and she has this extensive and elaborate and very impressive CV. And it's a pleasure and honor to have you, ma'am, as today as a moderator. Next slide, please. Yeah, and for today's panel, we have expert Dr. Meenu Agarwal, ma'am. She is currently the president of Pune OBGYN Society and elected Secretary General of International Society of Gynecology Endoscopy. She has done bachelor's in reproductive endoscopy surgery, European board certified, and she is the course director of endoscopy and ART training courses in UAE. Over 12 publications she has done in international journals and first author of 4 books and authored many chapters. She's bachelor in reproductive endoscopy surgery. She has bagged many awards like India's Greatest Leader by Asian One, Icons of Health by Times Group, Inspiring Gynecologist of West India by Health World, and Champion of Foxy Award by Foxy. So it's an honor to have you, ma'am. Along with the experts and moderator, we have eminent panelists with us. Can I have the CVs directly? Yes. So today we have Dr. Pranjal Sharma, ma'am. Ma'am is the, yeah, she's currently working in the Sharma Hospital, Amravati, and president of OBGYN Society, Amravati. She's donal coordinator, Amogs, past donal coordinator, chairperson, website and publication committee, Amogs. She's doing the great job. Organizing chairperson, Amogs zonal coordinator, Adolescent 2022. So next slide, please. Yes, next as a panelist, we have Dr. Monica Gupta. She is HOD and senior consultant, Daksh Hospital, Alwar. And she has won many awards, as you see. And she has publications of editor of Foxy Newsletter, Alwar. And her special interest in high-risk pregnancy and pregnancy with medical complication. Next slide. Then we have Dr. Rashmi Kahar, madam, who's currently the chairperson of High Risk Pregnancy Committee, Amogs.
Thank you, Revati.
And hello, ma'am. Hello. Yes. And yes,
You
she's
can
from
go ahead with
Amravati.
your time.
Yes. And we have Dr. Shatabdi Dey. She has done fellowship, MS DNB, fellowship in reproductive medicine and consultant Nova IVF. Next.
Dr. Mangal Rathi. Madam is practicing at Paratwada district, Amravati, and as we see, she has won Wonder Amoxian and Wonder Oxygen Award. The important and interesting point is she is a great swimmer, and she has published a nice Marathi book and distributed it free of cost. Next. As next we have Dr. Bharti Rajshekar. She's currently the president-elect of Kasoga, KPMEA State Vice President, Indian Red Cross Hassan Director, IMS State Past Vice President, and so it's an honor to have you, ma'am. Next slide. Next, we have our own past president, Dr. Madan Kamle sir, consultant OBGYN and aesthetic gynecologist. He's currently the chairperson of Amogs Aesthetic and Sexual Medicine Committee. Next. Dr. Shilpa Sheke. Yes, she is Associate Professor of OBGYN, Mahatma Gandhi Institute of Medical Science, Sevagram Varda, and she seems to be very actively working there. So I welcome again all the moderators, experts, and the panelists, and I request you all to please start the session.
Thank you very much, Dr. Hirti, for the wonderful words of introduction for me. And I really bring a very good evening to all of you, and I bring greetings from Adolescent Health Committee, FOXY, and from Patna OBGY Society. I'm very pleased to see that Amogs Public Awareness Committee, in association with FOXY PAC Committee, has joined hands, and such a wonderful webinar on adolescent health has been is today that we are joining. And I really thank the FOXY leadership, Dr. Jaideep Tang sir, as chief guest, Dr. Rajendra Singh Pardesi sir, who is really a father figure, or elder brother figure, whatever you say, the humble person, Madhuri Patel madam, then Sujata Dalvi, madam, who is the secretary of Amogs. I also have my gratitude to Dr. Kiran Kurtkate and Dr. Amya Purendre, Ajay Mane sir, Monica Umarban, the two Monicas. I'm very happy to see you both here together. Then there are many other Monica, Revati, and one was Satabdi. Thank you very much. And thank you, Priyankur, for having me here. And I really appreciate Dr. Sneha madam, Dr. Sarita madam, and everyone, Dr. Supriya Arwari, my Supriya Square. I really love to see her, Dr. Anita Sabriwal, Parag Biniwale sir, and everyone. Girish Mane, I really miss him today here. So with all these words, and gratitude to all of you for having me in this panel. Dr. Priyanku Roy is a little bit busy in his OT. He'll be joining soon. So
Can see Priyankur traveling.
Oh,
I'm there, ma'am.
Acha, you are here, so very good, very
Sure,
nice.
yeah, sure.
You finished your work then. Okay, so we
And
begin.
thanks for being here, and thank you everyone for joining. So please, you can start with the panel. Thank you so much once again.
Yeah. Can you see?
Not yet, ma'am.
I have shared.
Yeah, you have shared, but
Okay, let me.
please share it again, ma'am.
Yeah. My God. Has it come? No?
It is showing that double click to enter full screen mode, and it's a black screen, ma'am.
So shall I send it to you then?
Yeah, ma'am.
But I had
WhatsApp
checked.
me, ma'am.
I think it's a network issue from your side, Supriya. That's the reason. It is still not seen.
Okay. I'm so sorry. Mr. Abhishek, I have just
Yes.
sent it to you, just you can
Yes.
on your WhatsApp, but
Yeah, ma'am. Yes, ma'am, received.
okay.
Yeah, I am sharing the screen, ma'am, on your behalf. You just say next when I move the next slide.
Can I have the control? No.
Yeah. Ma'am, it's not possible, ma'am, to share the control.
Okay.
But you just say next.
Okay. So let us start with the panel. So we both of us will start with optimizing adolescent health, a gynec's role. What do we need to do in this case? Next. So we are here, both of us, and let me greet my panelists. Next slide. This is Dr. Priyankur Roy, and just skip these. Dr. Minu, I welcome Dr. Minu Agarwal, who is an expert, and all my panelists, Dr. Pranjal Sharma, Dr. Monica Gupta, Dr. Rashmi Kahar, Dr. Satabdi De, Dr. Mangal Rathi, Dr. Bharti Rajshekhar, Dr. Madan Kamble, Dr. Sheila, and Dr. Revati. So welcome all of you. Lovely to have you all in the panel. So first slide, please. So I'll start with the menstrual hygiene. Menstrual hygiene is hygienic practice during menstruation which can prevent women from the infection in reproductive and urinary tract. Poor menstrual hygiene is one of the major reasons for the high prevalence of RTIs in the country and contributes significantly to the women morbidity. Next. So I'll just ask Dr. Revati, what is the importance of menstrual hygiene management?
Ma'am, Revati is not the panel, part of the panel. She's the MOC. You can go ahead
Okay,
with the
but
other panel.
I think it was written somewhere. That is why I was. Okay. So any of the Dr. Rashmi can take this question.
Yeah, thank you, ma'am. Menstrual hygiene is of paramount importance in an adolescent's health. We should teach all the adolescents about it. Why? Because the use of the non-hygienic menstrual pads, or even keeping if the area has been kept wet for a long time, there are high chances that there will be some sort of ascending infection to these girls, and they may lag into reproductive tract infections and UTIs, which will be recurrent. So it is very important to teach the girls about the hygiene, and to prevent the infections, it is very important that they should maintain the menstrual hygiene.
Next slide. So rightly said, Dr. Rashmi, menstrual hygiene management plays a vital role in the physical, economic, and psychological development of adolescent girls. Traditionally, women in rural societies relied on used clothes for menstrual management, but more recently, their preferences have shifted towards market best formal products. So what is our role here? What is our role, Dr. Monica? Just you can add on.
Basically, what happens, there's a myth you should not touch the private
slide,
parts.
Yeah.
So we have to make sure that you have to clean it properly. Washing it with lukewarm water is important. And if you are using the clothes, because many of the people are not having the access to the market products, so they should sun dry it, because in the most of the India, sun is very good, and that is going to sterilize the product. We can ask them to use menstrual cup also, because they are also very economic and easy to use.
Next slide, please. Yeah.
And they have to change the napkins very regularly, because even many of times they are having very scanty bleeding, and they are using this for 1 or 2 days together, because they have spent a lot on that and they want to make full use of it. So we have to tell that is going to infect you, and you have to change it very properly. You have to use no other products are used, only lukewarm water is used for the washing. And you have to dispose of the sanitary napkin also is very important, because many of time they throw it off, and there is also a big question about the disposal.
Yes. So regarding menstrual hygiene, we gynecologists, our role is to make them aware, let them know these important things. 5 things like we have written here. Change your sanitary napkins every 4 to 6 hours to prevent infections. So once a young girl comes to you, you can even talk to her this way also. If she's suffering from some UTI, some STI, you can just ask her and just counsel her and let her know all these things. Wash yourself properly. Don't use soap or intimate hygiene products during menses, as it messes with the natural process of cleaning. Discard your sanitary napkins properly. Wrap them before throwing to avoid spread of bacteria. Stick to one method of sanitation. Do not use sanitary napkins and tampons at the same time. So these are the things actually, whatever they want to know, we gynecologists, actually we should let them know, and it is our moral responsibility to do so. Next slide, please. So these are the simple menstrual hygiene tips, and Dr. Bharati, would you like to read it out? This is very important for us.
Thank you for giving me the opportunity. And as told by the previous panelists, we have to catch them young and start early in inculcating good menstrual hygiene in all these young girls, because this is going to be a reflection of their reproductive health in future. And hence, as you rightly said, Dr. Supriya, we have to tell them to replace the sanitary pad irrespective of whether it is wet or not every 4 to 6 hours. And disposal of menstrual products, very importantly, though we have put up a lot of placards in all the toilets, we have to tell them that it should not be flushed in the closet. It has to be wrapped in paper and ideally kept in the container which is placed there for disposal of menstrual products. And of course, if they are in the rural areas, in villages at home, we tell them the same thing. And generally, I tell them that when you use the menstrual pads, please don't throw them just directly into the garbage. Wash them first, wash them and then wrap them in newspaper, and then give it in your garbage can, which goes to the incinerators or whatever sort of waste disposal system that particular area has. And of course, in villages, as I would say, where most of the girls stay, we don't have an organized system of waste disposal. So there, what I generally tell them is they all have these garbage pits where they put all the cow dung and all the waste material of the house. So they should see that it is properly wrapped in paper over there. And of course, sometimes if they do have a fireplace where they are boiling water or using, we can ask them to dispose there. And the undergarments, this is very, very important, because most often in practice we are seeing that parents are spending a lot of money for the outer garments, whereas their undergarments are usually soiled, stained or torn. So you need to tell them that undergarments and lingerie have to be disposed once in 6 months at least, and they buy a fresh pair of undergarments and wash them properly in lukewarm or preferably cold water and sun dry them. That's very, very important, because they have the tendency to dry their undergarments in the shade, and they wash them with warm water, which causes the precipitation of hemoglobin, and it becomes pigmented, and later on they don't feel comfortable because of the bad odor that it produces. And washing hands. During COVID, everybody was very, very careful about washing our hands. And I think even now we are laid back. We have to tell them they have to follow the 10 steps of hand washing before and after changing their sanitary pad or their menstrual cups. We do talk to them about menstrual cups. We demonstrate in our lab practice and in the schools. We take the menstrual cup and demonstrate. And if they are comfortable, we teach them how to use the menstrual cup, and that also has to be washed properly and kept in a closed container with their name on that and used repeatedly. And of course, bathing daily is what we need to tell them. They need to not only keep their mons pubis and perineum healthy, they need to also keep their other part of the body also healthy. We talk to them about that also. So this is very, very important, as you said, to tell them that menstruation is a natural process. The blood which is coming into menstruation is not bad blood, like all of them generally attribute to, and tell them that it is the same type of blood which is going to come when they cut their fingers. So let's respect that menstrual hygiene is important. And I think we need to talk to the men also when some parent comes with the father, comes with the daughter, or the parents come. We need to address this issue to the men also.
Yes, absolutely. Very good. Very excellent answer, Dr. Bharti. I know you have been doing lots of these camps and the education programs, so that is why you have explained very well the way of this menstrual hygiene management tips. So next slide, please. So this is another one. It is a human right. Menstrual hygiene is a human rights.
Surya,
So
can I just add on one thing?
okay, okay. Tell. Over to Priyanko. You tell. Next slide. Dr.
Yeah,
Priyanko.
I just wanted to take the yes, ma'am. I just wanted to take the opinion of panelist or on the use of menstrual pad. I mean, do you still agree to the use of commercial menstrual pads, or do you nowadays have at least shifted to tampons or menstrual cups, or at least natural, that is cotton menstrual pads? Is something that I wanted to ask. I mean, the opinion of our experts or the panelists who are present here.
Dr. Priyanko, here I would say that nowadays we are advocating the menstrual cups. We do talk to them, to the parents about, because they have this inhibition that, this cultural taboos we have in our society. But still, when I take an opinion or a survey of the girls walking in, many of them have already started using the menstrual cups, which is a very, very positive move in our country. And we try to tell them that it is cash free, crash free, and rash free. So this tagline carries a lot of weight, and we go to the schools and we talk to them. We are trying to bring down the use of the commercial pads, which are containing those gel foams and the nylon sheets, which are causing a lot of issues, not only to the girl, also to our universe. So we're trying to come out of this.
And we advocate the cotton pads also.
We use them to cloth pads as far as they are washed well, and it is not old rags and old used cloth. We tell them to buy, I usually tell them to buy 2 meters of cotton cloth, wash it and cut them into diapers, stitch the edges, and like handkerchiefs, you keep them and personally in a cover and use them. That's what
Dr. Minu, your opinion, please.
Yes, hello. I think I'm listening to everybody, and these are good options that you have. Menstrual cup, of course, came in with a very good positive thing. Most important that you can wash it and reuse it. So, as Dr. Bharati said, that we want to reduce the disposals. So, I think the menstrual cup is a good idea, but there are many girls who are not comfortable with menstrual cups. So, those they can use the pads, and they should be told that how to dispose of the pads. So that is very, very important.
Yes,
Yeah, my opinion on this is that the best thing to use for adults and girls is a cloth pad. Then the second would be use and throw commercial pads, and cup is very good, and it is the best actually for but not for the adults and girls, I would say, because then that will definitely involve a training of the girls for how to use the pad and reuse, and there could be some infection problems with that. So in my opinion, the cloth pad is best, and now the schools, they have vending machines, and with very little amount of money, the girls can get a commercial use and throw pad from that machine, and it is convenient. So for adults and girls, I would go for other options.
Yes. Okay. Dr. Madan, you want to add on something?
No, everything is covered now.
Yes. So the aims and objectives. Next slide, please. The 4 key areas for improved menstrual health and hygiene we need social support, knowledge and skills. Knowledge is very important here, because many people, we have even met people who don't know what is menstruation, why they should change the pads. So knowledge and skill and awareness, facilities and services, access to absorbent material and supportive supplies. These are the objectives. Next slide. So these are the same thing that we have already discussed, the hygiene part, increase access to the sanitary napkins or the menstrual cups in rural areas. See, we need to sensitize girls in the rural areas where they have very less knowledge, they are unaware of these facilities. So next slide. So these are all the same things. So what are the disadvantages and hazards of poor menstrual hygiene? This, I think, all the obstetricians, gynecologists should know, and line from all of you. Any start with any of the panelists? Dr. Shield,
Repeated
who has not,
infections.
yeah.
Hello. Repeated infections will be there if
Yes.
tampons are used or cups are used, and if they used for prolonged period of time, there are chances of toxic shock syndrome, which is
Yes.
staphylococcal infection. So counseling and training is required before that, as already have been discussed.
Yes. Next
Ma'am,
slide, please.
increased chances of yeast infections as well, fungal infections.
Yes.
Yeah.
Yeast infection, urogenital
One more
infections.
thing I
Next
will,
slide.
I would like to say, a few parents have questions. If they use tampons and if they use menstrual cups, is it going to affect virginity? Now the question of virginity testing is on rise, and that virginity test should be done or not in legal cases is also a big question, because use of these things definitely is going to affect the introitus opening, I guess.
Yes, it is. But then careful use of everything, the counseling part, there comes the role of all of us, we gynecologists, we obstetricians, we have to counsel them and let them know the proper way of using the any of the modalities, what is present, what is available to our society. So these
Sure,
are the
ma'am.
yeah. So next slide. So these are the infection part, then fungal infections. Next slide. Cervical cancer is not but sometimes constant and chronic bad hygiene can lead to any of the diseases. Next slide. So we'll switch over to the Mr. Abhishek. So these are the 10 menstrual hygiene tips every girl should know. Choose your method of sanitation, change regularly, wash yourself regularly, don't use soap or vaginal hygiene products, use the right washing technique, discard your used sanitary product properly, beware of a pad rash, use only one method of sanitation at a time, have a bath regularly, and be ready with one on-the-go stuff during your periods. Next slide. So this is all about menstrual hygiene. Now coming to PCOS, Dr. Priyankur, are you there?
Yes, ma'am. I'm there, ma'am.
Yes, yes. So PCOS, over to you. Can you read this?
Thank you. Yeah, yes. So basically, as you know, so as we know, PCOS is one of the main hormonal disorders some time now, and it is of course something that worries some women, of course, because of the irregular cycle buffet that we see normally attached as well with it. So the irregular menstrual cycle, excess hair, acne, and infertility are the primary thing to PCO, which is the worrisome thing that we all know of. And I think that's why whenever we have a lady with who has irregular cycles, especially obese, etc., we
Move to next slide. Dr. Priyankur, we are not getting your voice. Maybe your network is weak that side. Since you are traveling, I believe. Unable to hear you. So you just when he comes, where he'll take. So women can
Ma'am, am I audible now?
up audible now. You put off your camera.
Yes,
And,
yes.
that will give
Yeah,
you a
no
better
problem.
network.
Yeah.
Yeah.
Yeah. So we all know that women with PCO, especially after puberty, there are many who are diagnosed, especially in their 20s and 30s, especially when they are trying to get pregnant. That is when we have the most, the diagnosis is most common. And we also know that there is a higher chance of getting PCO if we have obesity or if there are other people with in the biological family who have PCO. The most common signs and symptoms of PCO, of course, include irregular periods, abnormal hair growth, acne, obesity, darkening of the skin, cyst, skin tag, thinning of hair, infertility. So, for our panelists, if I could just ask.
Next slide.
if I could just ask one question, what do you in your clinical practice find the most common symptom women come to you in with PCO in your OPD?
Irregular bleeding.
Irregular
Amenorrhea.
Yes.
Perfect. I
Yes.
think all of us will agree with this. And one of the most common things probably women want in today's day is probably hair growth. I mean, something to do with the hair growth. So what is it that you normally suggest for hair growth in your OPD is something that I would like to ask you in respect to lifestyle changes which are required for PCO.
Cosmetic treatment for the hair growth is much better. We can give the hormones to her. Spironolactone is another choice of treatment.
Next slide.
I think Dr. Madan
Yes, ma'am.
wants to answer.
Anything else that you want to add on?
Dr.
laser therapy,
Madan sir, you wanted to add something?
Regarding the control of her weight, we can advise her regular exercises, control on diet. She should be having healthy and regular healthy diet and regular exercise. That are the mainstay of controlling. And for the symptoms and signs of this acne and skins, we can advise her cosmetic treatments. But main is the change in the lifestyle.
Perfect. So I think
we would also, Dr. Priyanka.
Absolutely. So I think the primary thing that we need to look at, ma'am.
Dr. Priyanka, yes. As Dr. Madan said, along with the
Yes, ma'am.
medical management of what is that, the regulating the menstrual cycles and the lifestyle, I think for the hair growth, when these girls come to us, they do want some, they're very faddish about an instant thing. So we can tell them about threading and waxing in the initial stages till their hormonal levels have come to normal, their menstrual cycles are normal, their body weight has reduced to some extent with lifestyle management. And later on, the hair which has already come out, we can always advise laser treatment for them. Don't advise laser immediately. I would go for other non-laser treatment like threading and waxing in the initial stages.
Agreed. So I would say that initially, the reward is always bigger when the effort put in is more. So in respect to that, I think when we talk of,
I think he got disconnected. Dr. Supriya.
Yes. Actually, it's very difficult to take panel while
I'm so
traveling.
sorry, ma'am. I'm so sorry, ma'am. There are actually easier ways like gastric bypass or any surgeries that the sleeve surgeries etc. that a lady can do to lose some weight. But I think let us not suggest such a thing when, especially when you are like trying to lose weight, because lifestyle modification, when you put in some effort, you get bigger rewards. And the main thing that as Dr. Madan and all the panelists have mentioned, I think weight loss. And with weight loss, the primary things that you can do is exercise and diet. See, always remember that only diet helps us till a certain extent. But in addition to that, if we add on exercise, which will definitely help us in getting us fit psychologically, mentally, as well as physically. And that is something that I think we should remember always.
One thing I would like to highlight.
Yes, sir.
The new young generation is behind the zero figure, and they're not taking the proper healthy diet.
Yes.
Mainly youngsters of college girls.
Absolutely. So I think crash diet is yes, sir. Yes, ma'am. Please go on, ma'am.
We are seeing the lean PCOD patients also. They are not obese, but lean PCOD is also increasing day by day.
Absolutely.
Exercise role will be important and healthy diet will be important instead of weight loss.
Yes, minimum.
See, one thing we have to also understand that do not diagnose PCO on ultrasound. Very clear guidelines by ASHRAE that if a young girl has two symptoms, she has hypoandrogenism and she has regular cycles or weight gain, so these are enough to diagnose PCO. We should not go by ultrasound to diagnose PCO in
that is sort of
8 years post-menarche. So,
absolutely.
So suppose she gets her menarche at the age of 11, till the age of 19, ultrasound should not be a tool to diagnose PCO. These are the guidelines, because we all of us get young girls with the mother saying that we did an ultrasound and she has got PCO. So they come with the diagnosis of PCO with ultrasound report. So that we should refrain from.
I think it should be more of a clinical suspicion with probably ultrasound supporting it, but it should not be an ultrasound which is supported by the clinical judgment. So I think that's what Minu ma'am has exactly pointed out, and that is very, very appropriate and correct. And with irregular cycles, we do definitely write ultrasound probably for most of our patients. But clinically, when you look at things, we have to probably put in those points, tell her that you look PCO clinically itself, and there will be lifestyle modifications which will help you probably in bettering or
slide, please.
correcting this. Yes, ma'am.
Continue.
Yeah. So I think the lifestyle modifications, of course, as we talked, eat right, exercise, lose weight, vitamins, minerals, hydrate yourself, sleep well. That is very important. Again, rule out any obstructive apnea. Quit smoking or alcohol is difficult to say, because if you tell them to quit smoking and alcohol, most of the young girls in today's day will quit coming to you rather than quitting smoking and alcohol. Tell them to probably reduce it to a certain extent, and then probably they will be in a better off state to to get things right. Do not give them a bigger target. That's what I always say. Do not give them a bigger target of probably losing like 5 kgs in a month or something, which is not possible. Probably give them a smaller target. Tell them a target of probably 1 kg in a month, which is almost only 250 grams in a week, which is quite achievable. And I think the smaller targets, if we build up over a period of 6 months, that is almost loss of 6 kgs. That helps a lot. So that is something that we definitely need to look at. The diet that we say,
Next slide,
I
please.
did consult a dietitian, and we did talk about it. And they said the main important 4 things that we can try and tell a patient to avoid. 1 is rice. Number 2 is sweets. Number 3 is oil. And these are the important things that once reduced. And number 4 is, of course, sugar in the tea. Because these are the 4 things that if we reduce, they say that it's much beneficial towards losing weight as well. So if I can come to the panelists, whoever wants can take this question. Is intermittent fasting beneficial for women with PCO? I think Madan sir made the comment of, in today's day, women are more towards crash dieting, more towards doing
Next
diet
slide.
once in a day, eating at 8 o'clock, not after sunrise, sunset, etc. etc. A lot of things that are being done. But the only thing that we are not doing probably is following a healthy lifestyle. That is what is important. So can anyone take this comment of intermittent fasting? What is your take on it? And do you do it yourself, first of all? And do you advise it for your patients?
Dr. Priyankur, yes, intermittent fasting, there are studies which do show that it does help, and even our ancient Ayurveda does tell us that don't eat after 6 p.m. And I think definitely it
Yes.
does have a response, because I have tried it personally too, though it is a ping pong effect on and off. I keep doing the intermittent fasting. It does give
Yes.
a good system, and it does reduces the insulin sensitive resistance. But however, in young adolescent girls, when we are talking to somebody who's 15 or 16 years or 17 years, I think it's quite difficult to tell them that they need to do intermittent fasting with this food and their exercise schedule and all that. But of course, a certain category where they are grossly morbid obesity or a lot of overweight with a BMI more than 27, 28, this is a good option. And in my clinical practice, I do try to tell them to do this intermittent fasting, and we have found results.
Perfect. Anyone else? Any
But
experiences?
yes, controversial also. Many people they say that frequent eating is also important, because you take small meals that will lead to the less of the insulin sensitization. So the role becomes crucial, whether it is going to help. And intermittent fasting for even 16 hours or 24 hours is a big target. And you have to practice a lot for that. You are fasting for
Agreed.
24 hours in a stretch, or 16 hours in a stretch.
So I think we have
Yeah.
personal experiences from Bharti ma'am and Monica ma'am that have come in. We will take our expert opinion from Minu ma'am as well. Ma'am, any experiences personal or with your patients about intermittent fasting, and do you advise it?
Yeah, intermittent fasting, I think, is
Next slide.
becoming the, sorry, am I audible? Yeah.
You're
Yes,
audible,
yes,
ma'am. Please
yeah,
go on.
you are audible.
It's becoming the key thing for adults for sure. But for adolescents, I'm not sure whether we can advise them intermittent fasting.
So
Yes.
I think I would agree with, of course, Monica ma'am, with Bharti ma'am,
Abhishek,
as well
next
as Minu
slide.
ma'am. And I will go on to say this, that I think in a adolescent age group, it is more of avoiding fast food that is more important. And that is something that brings up, like, a lot of calories and a lot of weight in them. Intermittent fasting for adolescent is a little difficult. I also agree and believe that it's a little difficult because they might not follow. But for us who are like, almost into our 40s and, are not, have been sitting in the chair the day long and do not know what to do to lose weight, I think we have some motivation in intermittent fasting. At least we know that we are doing something for ourselves. I think that is something which is a nice feeling. And at the end of the day, even if we don't lose weight, we know, okay, we're trying something. Let's hope that something happens. And of course, we do get bored of trying something to lose weight over a period of 2 weeks or so, and then we want to try something new. And when we try something new, we do exhaust the options that are possible, and intermittent fasting definitely does help. I'm seeing that Dr. Rashmi Kahar ma'am is quite for a long time. Ma'am, any opinion, any
For
views you want to
all,
put in here?
Priyanka, for all the adolescent age group, I would say they should take
Next slide.
small and frequent meals. Why? Because with intermittent fasting, see, nothing
Next.
is proved actually clinically. But with intermittent fasting in adolescent, there would be fluctuations in sugar levels and insulin levels, and that is what we do not want in PCOS. We want to maintain a steady insulin levels. So, in my opinion, that may be right or wrong. Why? Because there is no evidence to prove it. I think small frequent meals would be more advisable than intermittent fasting.
Perfect. I think your patients do love you a lot because you advise them exactly what they want. But then it's very true as well, as you told the physiology behind it, and that's really wonderful. So thank you so much, ma'am, for your opinion. And of course, exercise we know helps. So there is no second thought about it. Exercise does help, and we definitely need to advise our patients to do, or not patients, even your neighbor, whoever is adolescent who is suffering from PCO, definitely exercise will help and is a motivation for your day-to-day activities as well. Next slide.
Next slide. Mr. Abhishek, next slide, please. And just wind up this.
So undeniably, a lifestyle disease, uncontrolled PCOS can lead to serious health problems like diabetes, cardiac conditions, infertility, depression, hypertension, etc.
Yes. So now skip one slide,
With
Mr.
this, I
Abhishek.
think I will hand over to Supriya ma'am to take us through the next part of the panel. She'll be talking about the challenges in the adolescents, etc. And she has done a lot of adolescent programs, and I'm sure that it will definitely be, the take-home messages will be beneficial for everyone. Supriya ma'am.
Thank you, Dr. Priyankar. So adolescent health, why we started with menstrual hygiene, that is very important. If you talk about adolescents, then the PCOS, every day we come across people, our neighbors, schools, anywhere you go, you will see PCOS. You can look at the females and you can feel they must be suffering from PCOS. And irregular menstrual cycle is the most common complaint they come with. So these two we have finished. Now the challenges, 45% of adolescent girls are undernourished. 20% of adolescent boys are undernourished. Early marriages is 26%, less than 15 years girls, 54% less than 18 years. So these are the data usually we collected. 10% adolescent girls sexually active. 59% adolescents know about condoms and 49% adolescents know about contraceptives. So these are 50% of all HIV positive new infections are in the age group of 10 to 25 years. So adolescent abortion, 1 to 4.4 millions. So you can just imagine the challenges we have in front of us about the adolescents, how much we need to sensitize them, motivate them, make them aware to get over all these things. So next slide, please. So here is a 18-year-old primey with 2 months amenorrhea comes for consultation. So what will you do? Next slide. So Dr. Rashmi, you can start with this. And what is the incidence of teen pregnancy? Straight away, I'll just ask you.
Madam, I think we can take opinion from experts on this question because
Okay.
I'm
Next
not
slide.
very well aware of the incidents.
Yeah, it's
Ma'am, the
quite
incidence of, ma'am, can I take this?
Next slide. Yes.
Yes, ma'am. The incidence, according to WHO in 2022, was around 43 per thousand women, per thousand pregnancies in India is a case of adolescent pregnancy. So that's the incidence in India, around 43 per thousand.
Yes, it's quite high. And these people, they have just lack of sex education, sexuality education in schools. These things have to be promoted. These people, they don't know about contraception. Many things are lacking in especially in India. Next slide. So girls and boys, they don't know why teenage pregnancy is so much common. So Dr. Satabdi, Dr. Monica, Rashmi, anyone can take?
Because teenager pregnancies are common because there's many a time there's a cultural belief to get married early. There's a peer pressure also. They don't have the knowledge about the contraception, and many times they get pregnant. And many times they also feel they want to show off also. Okay, they are fertile. So that is also the pressure among them. And many times they are abused they are they are having sexually abused and they got pregnant, and can't tell anyone about that, and when the pregnancy is proceed, uh, it is evident to everyone.
Yes,
And moreover, it's our role to tell them about the contraception and the they can say no to the sexual violence also.
I think we should also keep in mind the POSCO Act, because if a
Yes.
girl under the age of 18 and she comes, even though she's married but she's pregnant, so that has to be reported. So that has to be kept in mind from medical legal point of view.
Definitely, yes. That is very important once we deal with these age group people. There are many school dropouts because of this. So, Dr.
Madam,
Rashmi
just
and
one
Dr.
question.
Bharti, you can tell.
And one question, please. Ma'am, it's very easy to say कि we have to inform the police. In the Rajasthan, we usually get teenager pregnancy is very common. And for informing police for each and every case is very difficult. Most of the girls are into the sexual activity before the age of even 15.
Yes.
Yeah.
So how it's not possible for the every case to be reported to the. We have to send a long list to the police every day. If these are sexually active.
These are by the law guidelines, which we should know. And, even if we don't report, that is fine. I understand your point of view, Dr. Monica, that we cannot inform. If I am also in your place, I would also think the same way. But these are what is the guideline by law which is given to us. So we should be aware. Suppose somebody comes and you are looking little fishy, not, tomorrow they can go to the court or they may have a legal problem. Then the doctor should not get into that problem. So those
Yes.
cases at least should be reported, in my opinion. Yeah.
You have to follow the guidelines.
In our part of area in Maharashtra, we are compulsory reporting such cases to the police.
Absolutely.
Yeah, Dr.
POCSO
Monica.
Act has to be taken care of. You have to know what is the age group, where you have to inform the police, and the MTP rules, MTP laws, everything you have to know. And we clinicians, we have to follow the guidelines. In spite of so many glitches, but we have to follow the guidelines. So teenage pregnancy is very, very common in India. Next slide, please. So most of them are illiterate and they get in early marriages. Then what are the antenatal complications in teenage pregnancy? Supposing a female either out of marriage or with marriage, teenage means very early if they get pregnant. So what are the complications antenatal? Dr. Monica, you can take, or Dr. Bharti, you just speak out. Yes, ma'am.
Dr. Supriya, first of all, as Dr. Meenu madam said, once she's a teenager and she comes to you as a pregnancy, whether she is married or not married, we are bound by the legal implications. We need to report this to the POCSO. And of course, if you're in a private setup and you feel that it may be difficult for you to do, of course, though we know the guidelines, we can report, you can always refer them to the nearest district hospital or the medical college where they have the protocol in place and the POCSO regulations will be followed. And unfortunately, in this social complications, we see many of these girls who are young are delivering, and the father who is will be in jail till the problem is the court addresses the issue. But however, the complications, as we said, first of all, in pregnancy, they are going to have all the complications of pregnancy will be magnified in these girls. They will have increased incidence of anemia, increased incidence of pregnancy-induced hypertension, increased incidence of preterm deliveries, abortions, increased incidence of postpartum hemorrhage, and she will have all these other issues which will be more in case of these girls who have come with a teenage pregnancy, because they are still not yet, if it is true marriage, of course they would have come for an antenatal checkup, but if it is not, it is out of marriage, they would come to us late in pregnancy sometimes, and they were already anemic, requiring blood transfusion and admissions, or they may come with a preterm delivery. Incidence of sepsis is more in these girls. So these are the complications we should look into.
Next slide, please. Next slide. So the postnatal complications, once she has delivered, however, we have managed her the antenatal checkup, somehow counseled her, and she has landed up after in delivery. So postnatal complications, what are very, very common. Dr. Madan, you.
Yeah,
Next slide.
as her age and maturity is less, She's not knowing how to take care of the baby. They may face the complications regarding the breastfeeding because there is less knowledge um, uh, regarding the diet also, and the neonatal complications also. And most important is the anemia and depression, some mental health issues she can face. If the baby is premature, she doesn't know how to take care. And if they are illiterate, then again the problem worsens. Main
Yes.
problem is the neonatal care and personal care.
Yes, because they are not themselves ready for the pregnancy, and premature, these teen pregnancies, they don't know how to take care of their children. So they take care of the neonates, how to handle them, and most of the time they land up in these complications. So this is a very big social problem that we gynecologists, we obstetricians, we have to take care of all these things. The social stigma that lies with this and the complications, the role of obstetrician gynecologist is huge. So we keep on counseling, like spacing. Once she is pregnant, the next time we have to tell her about the contraceptions, about the spacing. So these things, and proper breastfeeding, and how it breastfeeding helps in contraception. So many things we need to sensitize these females. Next slide. Just come to how to prevent the teenage pregnancy. Next, next again. Next. How can you prevent teen pregnancy? Next.
Yeah, I would like to ask this question. I would like
Yes.
to answer this question.
Yes.
Mainly, the education is important.
Yeah.
Along with the adolescent health education, parents' education is very important. We have to educate them regards to the contraception also, and avoiding the early marriages. We have to advise them regarding the safe sexual practices, and if um, awareness. We have to create the awareness regarding everything, avoidance, complications, and some legal things. We have to inform the mainly the parents should be well educated about this, and effective implementation of POCSO Act, that is very much
Very
needed,
important.
because many the general public doesn't know what is POCSO and what is the severity of it.
Yes.
Doesn't know.
We had a talk on POCSO Act, and many of the gynecologists, our own colleagues, juniors, nobody knows. Many of them came up to say, "Ki, it is for such a nice session, we came to know such new things," because we need to know, even though every day we are not handling the same type of cases, but still, like Dr. Sneha also just commented in the chat box, that we need not take permission. We should know. We have to inform whatever the condition. According to the POCSO Act, the police should be informed in such cases. So next slide, please. And so these are the ways we can prevent the adolescent pregnancy, teenage pregnancy. Next slide. So all they should be well versed with the adolescent contraception. See, once the unmarried young adolescents come, it is not advisable to tell them that take this contraception or any type of. So what my panelists have in their mind about contraception advice to the adolescents? Dr. Bharti can take this question. Contraceptive advice to the adolescents.
Yes. So whenever these adolescent girls come to us either for pregnancy or they come for any other reason, we could have some confidentiality, be a little friendly with them. And if they do come with their boyfriends for a contraception, first of all, be friendly, don't intimidate them, and don't be judgmental. This is very, very important, because otherwise they're not going to open up to us. Of course, the options they have is one, if they are compliant and they are comfortable, I think the barrier contraceptives, the condoms would be the best choice for these young children. And of course, if there is somebody who's having a regular partner and they are going and having regular sex, they could also be given the OC pills, provided they don't have any medical contraindications. Or you have to go with the MEC wheel. Take out the MEC wheel and just take a history. Take time to spend some time with them and tell them. So I would either advise a barrier contraceptive or an oral contraceptive pill with a low dose estrogen. But of course, if they are young adolescents with just 17 years and 16 or 15 years, I would always counsel them to go against premarital sex. But if they are still saying, and we cannot be judgmental, and sometimes there's a lot of controversy on what's this sexual independence of the adolescents, because there are some contenders who say that this is a natural phenomenon. So sometimes sexuality is to be addressed in these girls. So I would preferably tell them about barrier contraceptive, because it not only protects them from pregnancy, it will also protect them from STIs and HIV infections. And along with that, it is a cheap mode, and it will not interfere with any of their physiological parameters.
Yes, perfect. So
Ma'am,
next
I would
slide.
can I add
Huh.
something, Monica,
Yes,
Supriya
sure,
ma'am.
Satabdi. Yeah.
Ma'am,
Yes, yes.
he said, ma'am, yeah, when we advise contraception to any adolescent coming to us, there are a lot of myths that the adolescents have in their minds regarding various forms of contraception. I think to begin with, we have to make it a point to clear each and every myth that they have in their minds. Various myths like using a oral contraceptive will lead to weight gain. Using oral contraceptives will lead to increased chances of cancers. They don't have any other benefit. When they use oral contraceptive for a long time, then post that they will develop infertility, like rather their return to fertility will be much later. So there are various myths, very very common myths that the adolescents have. These adolescents, they discuss it in their peer groups, and there is no one to clear those myths. So before advising them any form of contraception, it's very clear important that we clarify these myths, give them the facts, and then go ahead and advise them contraception.
And we have to ask about their history also. Many of them are having menstrual irregularities. So if we are
Yes.
giving OCs, both purpose can be solved.
Yes. So next slide, please.
So I think these girls who are already sexually active and the younger age group,
Next.
can also give them the cervical cancer vaccine.
Yes, that is very important. These days, Dr. Minu, lots of work is going on in cervical vaccination. So that is very important. And all over India, even the government has come out with a budget that all the adolescent girls, they'll be of 9 to 14 years of age, they will get free vaccination. It's just in the process of well, maybe the government hospitals will have the free vaccination. So that will be a real help to the adolescent community. So next slide. You just
HPV vaccine is better to be given before starting the sexual activity.
Yes, that is 9 years. That is why
12 to 14 years is what they are advising.
So we have another very few minutes left now. So what is gather approach? Actually, what happens, the adolescents, they won't open up to you. So you have to greet and build rapport, ask questions and listen to them, tell her relevant information, help make a decision, explain the method, effectiveness, side effects, how to use, and return for advice for further questions. So you have to be very open to the adolescents, very, very gentle with them, and try to listen more to them rather than giving us, supposing a pregnant adolescent comes to you with a boyfriend. We won't, we'll try to solve a problem rather than why did you do, and nobody is ready to listen these days because you have to teach them, not preach them. So we'll have to make them safe. We'll tell them how to have safe sex, not to get pregnant. Once she's pregnant, what are the methods she can go for in termination? What are the rules, laws, everything? But this is the way you can approach the adolescents so that they can open up in front of you. Here, the clinicians have to be very patient, and counseling part of us is very important. So, next slide. These are the methods. Next. 3, 4, just skip the slides. We don't have much time now. Next. Again. So come to the take home messages last. So this is the POXO Act. We're back 1 minute. Come to the POXO Act. Yes. So POXO Act is here actually in a brief, just it is a you have to inform the police, inform the CWC, give treatment. India made the code is Protection of Children from Sexual Offences Act 2012. It started long title like an act to protect children from offences of sexual assault, sexual harassment, and pornography, and provide for establishment of special courts for trials of such offences and for matters connected therewith or incidental thereto. So this is the POCSO Act. This is mainly for the children to protect their rights, to help them not being harassed by certain group of people. So this is very important, and we all of us we need to know it in detail. Next slide. Next. Skip this. So abortion allowed till 24 weeks of pregnancy in special cases. This is also the law. Under the new rules, 7 specific categories will be eligible for termination of pregnancy up to 24 weeks. Survivors of sexual assault or rape or incest, minors, then change of marital status during the ongoing pregnancy, widowhood and divorce, women with physical disabilities, mentally ill women, then malformations that have a substantial risk of being incompatible with life, or if the child is born, he or she may suffer from serious physical or mental abnormalities, and women with pregnancy in humanitarian settings or disaster or emergency situations. Next slide. So this was the recently the law came. So now the take home message. Dr. Priyanku, are you there? So just to sum up, the adolescent health is very important, very vast, and the adolescents consist of huge number of the global population, and they are the future of us. So summarizing the role of gynecologists in optimizing adolescent health is reproductive education. Gynecologists educate adolescents about reproductive health, including menstruation, contraception, STIs prevention, fostering informed decision making. This is what we all discussed now. Menstrual health support, like gynecologists should help manage menstrual irregularities and provide guidance on menstrual health, ensuring adolescents receive appropriate care and support. Contraception counseling, gynecologists offer comprehensive, like we should offer comprehensive counseling on contraception, empowering adolescents to make informed choices about their sexual health and well-being. Please be open to them while talking about the sexual health. STI prevention, we should educate adolescents on STI prevention, testing and treatment, promoting safe sexual practices and health awareness. Then the gynecological examinations, we should perform pelvic examination and screening if needed if they are sexually active, ensuring early detection and management of gynecological issues in adolescents. Next slide. Next slide. So these are the, we should also diagnose and manage the gynecological condition impacting adolescents, providing essential care and support. Then we should be supportive, create a supportive environment for adolescents to discuss sexual and reproductive. This SRHM, this has become very important. These sexual and reproductive health concerns, guiding responsible decision making. Then mental health consideration. Mentally also, there are many mental health issues in adolescents. So we should offer support and referrals as needed. Then collaborative healthcare, like gynecologist, and should be collaborative with other healthcare providers to ensure comprehensive care for adolescents, addressing both gynecological health and overall well-being. Then you also take care and practices that promote adolescent reproductive and sexual health, as we said. So these are the points, highlights, and vital role gynecologists play in promoting the health and well-being of adolescent girls through education, support, and comprehensive care. Now, I would like to take one-line messages from all the panelists and the expert also for what our role regarding all these adolescents have huge number of problems. So what is your role? What is your take? One-liner take-home message from starting from the expert. Meenu, madam, you.
Oh, I think I loved your statement. Don't preach, counsel. Advise them for safe, whatever they are doing. We are not their moral advisors, whether it is morality correct or wrong. We should tell them how they can prevent from getting any infection, how can we can prevent them from getting pregnant when they don't want to get pregnant. So all that advice should be given, but no preaching.
Thank you. Thank you. Wonderful. Dr. Bharti, ma'am.
Supriya, Dr. Monica, and Dr. Priyankur. Thank you for this excellent session. And my line is, adolescents are the future of our country and our human race. So advising and advocating for these young girls is of, not only girls, I would say the boys too, is of utmost importance. And as Dr. Meenu Madam said, don't preach, please teach. I think that should be the tagline we should follow, because preaching is very easy. But then we need to make them understand why we are trying to do that to them, and always be friendly. Talk to them like a friend. Sometimes they're not comfortable with the parents. You can always ask the parents to sit aside for some time, and don't be judgmental and don't intimidate them. Talk to them like friends, so that every time they're very anxious, very happy to come back to us every time, and praise them for even small things. Like a PCOS loses just 200, or you're looking so beautiful, you're looking smart. These things make them feel very comfortable to come back to us again. I think we should rather than a doctor, we should be a friend to them.
Friend. Thank you very much. Dr. Satabdi?
Ma'am, my take-home message would be to not be judgmental and give them appropriate choice. Choice regarding contraception, choice regarding their lifestyle, but give them choice and don't be judgmental.
Yes. Dr. Monica?
Madam, in my opinion, in the gynaec OPD, we can't give so much of the time. Better we should do school programs regularly. We should give them information, and we can ask them if they have any question, they can come to us, or they can just put a message or write on the paper so that we can solve their problems. Because one-to-one counseling is very, very difficult and time consuming. So when we are going to the school, we should tell them about the menstrual hygiene, diet, anemia, all contraception, safe abortion, all in the small words in the same sittings. So at least they have some knowledge. Okay, there is something, they can get advice from the doctor. Many times they don't feel for this problem, they can seek their help from anyone.
Yes.
That is the basic problem, I feel.
Rightly said. Many school health programs are going on, and our gynecs, they go regularly, they do. But in spite of that, once the patient comes to you in your clinic, you have to spare a little bit of time, keep some patience, and counsel them.
I just to share a small incident with me.
Yeah.
I did a kind of a program in one of the schools, one of the high-end schools in Pune, and I had two 9th standard girls who came up to me and said, "Doc, I don't get attracted to boys. What do I do?" Even for me, I did not know what to answer them.
Yes.
Because, we are dealing with patients all the time, but it was so difficult to answer them. I just said that you wait for another 1 year, look at your sexualities and, whatever. But they come up with difficult questions even for us sometimes.
Because madam, our mindset is different and the adolescent mindset is very different. What they want from us, we don't know.
Yes. Dr. Madan?
Yeah. More emphasis should be given to promote the vaccination regarding the prevention of cervical cancer. That should be taken care of by we as a gynecologist, as a society, and as a large society like FOXY, and along with the government.
Yes.
I think this, in the long-term view, it is, I think, very important.
Yes, that will be a part of the vaccination schedule, you can believe. We get a DPT and all of those things in the childhood. So starting from 9-year-old girls, they should be vaccinated before they start any physical contact.
Now, what happens when they get married? They won't take vaccine.
Yeah, they won't.
We have to promote just before the marriage.
Yes.
That what I.
Yes, rightly said. Dr. Rashmi?
Yes, thank you, ma'am. Ma'am, when a patient, adolescent obese patient comes to your OPD, just do not dismiss her in one line that lose your weight. Never do that. When there is PCOS and she is obese, that means there is a certain element of depressive psychosis in that patient. And we never know this is the result of the obesity, or obesity has given rise to anxiousness and overeating, and then again depressive psychosis in that patient. This is a vicious cycle. So what is important is counseling to this patient, non-judgmental attitude, and not to dismiss the patient just by ordering and saying that your problem will be solved if you lose the weight. No, don't do that.
Yes, correct. Dr. Sheila?
Yes, ma'am. I would like to say adolescent should be our focus, and what we should do is we should be doing some collaborative program with schools like adolescent school health education for in a large scale manner along with Foxy, so that every student or child should be aware regarding what are the issues what we just now discussed. The key messages should spread to them also. As you have already said, don't preach, always teach. So to teach that model, I think we should be we should focus on including this in our Foxy.
Yes, very well
Thank you,
said.
ma'am.
Anyone else? Dr. Priyankur, you have to say something? I think he's okay. So with this, we come to the end of the panel, and I really loved all the panelists. Everybody had their own views and lots of inputs, and we really need to take care of the adolescents. And please, one word from me, that have patience, counsel them, teach them, make them aware, and keep on a good follow-up. I have got many adolescent girls who are almost like a friend to me. So thank you very much. Thank you for the opportunity. Amogs.
Thank you, dear Supriya ma'am. It was an excellent panel and very informative and interactive.
Thank you, Dr. Supriya, and thank you, Dr. Priyankur, for moderating such a wonderful session. Very nice. Thank you so much.
Thank you. Thank you, Public Awareness Committee.
Yes.
Thank you, Supriya ma'am. Thank you, Priyankur, for moderating an excellent panel discussion and getting the best out of our panelists today. Thank you, Meenu ma'am, for being an expert for our panel discussion, and we wish you all the very best for all your future endeavors in Foxy.
Thank you.
Bharti ma'am and Rashmi ma'am, wishing you the very best for your elections as chairpersons for your respective committees. We thank you for joining us today and having a very fruitful discussion on adolescent health. I'm very sure that we all of us will do our bit a little more after listening to all the experienced people who go here. Thank you so much, everyone.
Thank you, dear Monica, for such a wonderful program and involving us.
Yes, and thank you, everyone. Monica and Revati, for involving with so much of sensitivity also that you're going for. Thank you very much for that.
Thank you so much, ma'am. Thank you.
Thank you, Dr. Meenu. I wish you all the best. Dr. This one, she left, I think. Rashmi, she's also going for something. So really wish you all the best. And
Monica Gupta.
Monica, I want to see you rising and rising and rising.
Thank you so much, ma'am,
Thank
for your
you.
best wishes.
Ma'am, I would.
Hi, Supriya Square.
Supriya is there.
Yeah.
Yes, Supriya Square is there.
Shairi,
everybody, all the best.
एक बाय बाय वाली शायरी तो होनी चाहिए.
एक शायरी रश्मि, all the best to you.
एक बाय बाय वाली शायरी तो होनी चाहिए.
अभी एक शायरी जवानी की हो गई, अभी एक बाय बाय वाली शायरी हो जाए.
अदरवाइज यू कैन बी वैलेंटाइन डे की शायरी भी चलेगी. वैलेंटाइन.
तो अच्छा वैलेंटाइन की चाहिए.
Yes, because before that we are not meeting again, no? इसलिए.
तो ओके. तो वैलेंटाइन की शायरी ऐसे है कि दोस्त आए थे मजार पे, मजार मीन्स कब्र, राइट? दोस्त आए थे मजार पे मेरी, अफसोस जताने को, मजार पे रखा हुआ फूल भी कमीने ले गए वैलेंटाइन डे मनाने को.
Lovely.
You are the best.
Thank you so much.
Best and
all of you.
Bye.
Love you all.
Bye. Bye. Thank you very much.
Bye.
Bye.